George. I'm sorry, I forgot. I'm very sorry, I forgot. We are live. This is a hybrid meeting. So please, when you do speak, for anybody who's listening from home or in the office, can you please state your name and what your role is within the council, please? Thank you very much. George, can we have apologies, please?
We have no apologies this morning.
Yeah, I should probably declare there I'm a governor of Dorset Healthcare appointed by this council, and my wife works at Yeovil District Hospital as the senior manager.
Sorry, can we confirm the minutes of the meeting held on the 10th of January and move their adoption? Thank you very much. Does anybody have any questions or comments that they wish to make? We have no questions from the public and no councillors' questions today. So the chairman's update, I don't actually know what Jill was going to say. I know she wanted you to be aware, and as some of you who are here in the room, we did have a meeting around the stroke service and the reconfiguration of Somerset and Dorset Council Hospital, Dorset County Hospital, which was very useful and very interesting. Oh, Mary's nodding. I don't know if anybody wants to say anything about that briefing. I personally am finding them really useful as a way to catch up with things and find out prior to meetings about what's going on in advance, especially for those of us who weren't involved with health, especially because we weren't county councillors. So thank you. Review of the council's performance dashboard. We've had a meeting, and I see David's here as well. We've had a meeting, or two meetings we had to delay because the figures weren't quite ready for us. We had apologies from Matt Prosser around that for those of you who did attend the meeting, and we had another meeting yesterday. And we had a useful chance to have here's Jill. We had a useful chat and a conversation around the things that we might want to bring up within the committee today. Is there anything anybody would like to say about that? Hello, Jill. No. And we had a really interesting briefing with SWAST. Jill and I went over to BCP, and it was a joint meeting with their Health and Scrutiny Committee, and Nick attended in person there as well, and some members who are here in the room were online for that meeting. It was useful on many fronts because we were able to chat during the meeting and after the meeting with some members from BCP and see their sense of direction and the things that were concerning them, which is more or less the same things as us. Of course, they don't have the rurality problems that we have here, but their issues, we were side by side on everything. It was really useful to have the ambulance service and the NHS in the room together with us and them to be answering the questions. And because it was not a recorded meeting, they were able to be honest with us about things when we answered questions, which was refreshing, really, because we really were able to get a picture of how it is now and where they think their sense of direction is. And they were honest about the state of their transport and their numbers of staff. Nick, do you want to say anything about it?
Yeah, I think it was a really useful meeting, and I think we probably should hold more of them. As you say, we have similar concerns, and it was refreshing to see how the guy who represented NHS Dorset, the right term, he was very honest. Partly because it was a closed meeting, to be fair, but he was refreshingly honest.
Ray Bryant may have been really interested as well, because they shared with us that we got onto the environment and the green issues, and we had a lot of conversation around how much waste the NHS. Belinda's nodding. She obviously knows through pharmacy as well, and all the different work that's being done to try to cut down on that. And that, for myself, that's something I know there's a lot of waste. Just when you get medication, you can tell the amount of waste. But I'd not thought of it as part of our work, if I'm honest about it. But of course it is. It has to be on every one of our minds. Jill, did you want to say anything about that?
Yeah, I think the only thing I would like to add, one of the reasons we did it as an informal working group. It's actually quite complex to work out a mechanism for us to do it as a formal working group because of the two councils and how do we report back and how do we make recommendations from it. But I think it was a very positive meeting and a very good way forward because considering that health is pan-Dorset, it's not just us, I think it's good to consider issues pan-Dorset whenever we can. So I think some of the issues that are coming up, particularly around the ICS and other joint issues like that, I think if we can do them as informal working groups. The other thing is it saves officer time quite a lot. It takes more of our time and we have to sort out the hosting issues. But I've spoken to the chair over there and the next one will be hosted over here by us. But I think the next one won't be until at least the summer because as you're aware, they have elections over there. So until there's a new committee and they've sorted out what they want on their agenda and we can push it with our agenda, then that's on hold at the moment. But I think probably later this year we'll have another one and host it over here. Okay?
Thank you very much for that. I don't know that you wanted to say anything else because we're in Chairman's update, Jill.
Okay.
And I didn't know if you'd made any other notes you wanted.
Have you mentioned housing?
No.
Okay. The only other update was I think we were expecting the housing working group to be reporting back to this meeting. It hasn't been able to. We have more meetings on that, trying to bottom out a few issues on it, and hopefully it should report back on the next meeting. There has come in during the last few months a request for us to look at service charges that registered providers are doing. As you all know, I sent you all an email about a couple of weeks ago asking for any examples. We will be looking at this as part of the housing working group. But whether this will come out and be a separate piece of work, I don't know at the moment. It just depends on the responses that we get from the RPs. And I think that was all I had on my chairman's updates in addition. And can I apologise for my lateness, please? Right, if we can move to the next item. Okay. Oh, brilliant. Okay. We're going on to the improving acute hospital-based stroke services in Somerset, the consultation. If I can just give a quick background on this, we had Somerset at our meeting last time, I seem to remember. And in the interim, we've had a meeting where we spoke to the stroke services at DCH, because any changes that happen in Somerset are going to affect Dorset residents, particularly those in the north. So after the meeting with our local stroke services staff at the NHS, we thought it would be worth bringing it back to this committee for us to consider if we wanted to take part in the consultation that is going on in Somerset. So at the moment, because no decisions have been made in Somerset, we can't start making decisions for Dorset. However, any decisions they make will impinge on Dorset and will impinge on the staffing for DCH. So I think what I'm going to propose is that we look at this and make a decision as to whether we want to take part in the consultation. Now, I've got Sally Barrister and Bannister. Sorry, I can't read your writing, Molly. Oh, really sorry. And Kirsty Hillier here from your you Somerset or
Dorset.
You're Dorset NHS, to answer any questions we've got. But if I can open it to discussion, you've got the papers from Somerset ahead of you, in front of you. So the decision we need to make is to whether we want to reply to the consultation. Do I have any speakers, please? Okay. If I can go to Robin first. Sorry, Councillor Legg, thank you.
Not sure whether I should stand up or sit down. I'm Robin Legg. I represent Sherborne Rural, which is basically the ring of villages around Sherborne town. So my ward is right on the boundary of Yeovil. In fact, it goes, well, within a couple of miles of Yeovil District Hospital. Can I ask some questions first, please, on the paper which you presented and some of the figures? And on page 24, you set out on the right-hand side a column talking about the patients who get transferred to other places. And it says, as I read this, that the proportion of patients who currently go to Yeovil District Hospital who would then start to go to other places, and it says 56%, around 255, would go to Dorset to Dorchester Hospital, 10% would go to Bath, and 4% would go to Salisbury. By my little calculator, that totals 70% in all. So 30% presumably are those patients who would be transferred from, essentially who are currently going to Yeovil. They would end up in Taunton, and that's 138. Is that interpretation correct?
I think my colleague from Somerset is having some IT issues, but I think her microphone's just switched on.
Yes, sorry, thank you. Sorry. Hi, I'm Julie Jones. I'm Programme Manager for Stroke, the piece of work of Stroke in Somerset. Yes, you're right. That's about right. So less would go to Taunton, and more would go to Dorchester.
Okay. Those figures actually tie in, not completely, but reasonably well with the figures we were given. Was it a couple of weeks ago in the closed session when you had the representatives from Dorset attending online? You've also got a table on page 30 where you talk about journey times. And again, the figures there show that the bulk of the delays would be between 15 and 35 minutes and would amount to something of the order of about 350 people having longer journey times. I mean, yesterday it was snowing. I know Somerset is a bit low, so probably you didn't have lying snow on the ground, but we certainly had lying snow on the upper road between Sherborne and Dorchester. And this morning it was a lot of low cloud, and there were convoys of tractors presumably towing trailers full of silage. So the journey south was a bit slower than it usually is. I mean, obviously my concern, and I think probably the concern of many people, is that essentially we seem to be on the northwest frontier, and we're all going to have to travel a lot longer before we actually get care in the unit that we need as a stroke patient. And I've said this before in this committee. I mean, one of my friends, school friends, had a stroke just over a year ago, and fortunately the ambulance turned up very promptly, took him to Yeovil District Hospital, and he's made a very good recovery. But if he was being taken to Taunton, or if he was being taken to Dorchester, he'd have a much longer journey. And I think the real concern of people in the northwest frontier is the journey times.
Yeah, thank you for that. And I think that's something that's come up as we've been consulting with everyone, really, concerns about journey times. I'm sorry if there's some background noise. I'm in a busy place. So I think if my consultant was here, he would say, although there may be longer ambulance journey times, actually the crucial bit is getting to the right place to get the right treatment as quick as you can. And at the moment, neither of Somerset's hospitals have a 24/7 stroke specialist service. So out of hours, people will be seen by our emergency department staff, usually a medical registrar, who will need to liaise with a network of consultants to get a diagnosis and treatment. So if he were here, he would say that although there's longer journey times, it outweighs the quickness of getting to a scan and getting the right treatment by the right specialist teams. Now, we know in Somerset, but doing nothing is not an option. We have a problem with recruitment, as everywhere does, and sustaining 2 hyper acute units, which is the first 72 hours of someone having a stroke, is just not possible. And so therefore, we need to really think about having 1 hyperacute in Somerset, so that we get 24/7 specialist stroke service in place, so that people can get the quickest treatment that they can, which is either clot busting treatment or perhaps going on for a thrombectomy, which is the removal of a clot. So it is something that many people have raised during this consultation around journey times. We already transfer our cardiac patients to Taunton throughout Somerset for their heart attacks to have their treatment, and that's been going on for a number of years. So this is similar to that, but stroke, is a need to be urgently treated, and so therefore we need to make sure we've got the right staff who are going to give the right treatment and get that done quickly.
Can I return to the question about, since you've mentioned it, about recruitment? When we had the presentation from Dorset, and Dorset have already got their £3 million for a hyperacute unit in Dorchester County Hospital, it was obvious to me, and I think probably everybody else who was listening in on that, that because the hyperacute unit is going to go ahead in Dorchester, that from the perspective of staff at Yeovil Hospital, if you want to stay in stroke services, you might actually decide to transfer to Dorchester because they've already started recruiting. And that seems to me to be a real fundamental problem with this consultation. It looks to me as if, from a practical point of view, the consultation's already, or the decision's already been made. Because for the staff, they will go to where their long-term security will be.
Yeah, you're absolutely right. And there is always the case that actually Yeovil staff may want to transfer to Dorchester. But as far as recruitment is concerned, we have been trying to recruit to Yeovil for many years. We've got a part-time consultant there, and we've got a locum consultant. And the part-time consultant is due to retire in the next couple of years. They've been out to recruitment. It's been difficult to recruit. With a smaller unit, you have much more difficulty with getting people to apply because this is an on-call service, and so therefore the more onerous the on-call, which could possibly be 1 in 2 weekends, then that's not attractive to many physicians. Also, you need to have a critical mass, and to run a 24/7 service on 2 sites would require the minimum of 6 consultants on each site, and I don't think we would be able to recruit that many consultants to continue to run a hyperacute unit on both sites. You're absolutely right. We are saying we want to have 1 hyperacute in Somerset. What we're going out to consult on is whether we have an acute stroke unit at both Taunton and in Yeovil, or whether we actually have 1 acute stroke unit which would stay in Taunton alongside the hyperacute. So we are proposing that we have 1 hyperacute in Somerset in Taunton, but the 2 options and what we're asking for is feedback and the impact of having an acute stroke unit on both sites or on 1 site. Does that answer your question?
It answers the question, the last question I asked. If you'll indulge me with just one last question. and that is, again, when we had the presentation from Dorset, there was the issue about transferring between the hyperacute intensive care unit after 72 hours and then going on to an acute ward. And I think what came as a revelation to me, and maybe some of the others who were listening in, was the idea that if you were in the northwest corner of Dorset, or indeed in South Somerset, the ambulance service would take you automatically to Dorchester. At the end of 72 hours, there was then an issue about where do you go next? Because one would assume perhaps that if you were already in Dorchester, you'd stay in Dorchester. But the message we got from your colleagues in Dorset was that at the end of 72 hours, at the very least, the Somerset-based patients would transfer back to Somerset, which either means to Taunton or to Yeovil, if there is going to be an acute ward in Yeovil. Is that your interpretation as well?
Yeah, so under option A, where we would have an acute stroke unit on both sites at Taunton and Yeovil, those people who go to Dorchester for their hyperacute care actually live in Yeovil, or their families are nearer to Yeovil, then we would look at transferring them back to Yeovil to the acute stroke unit to go on for their onward rehabilitation, hospital rehabilitation. And option B, if all of the hyperacute and the acute beds were in Taunton, I think we would not be wanting to transfer people anywhere. We would be keeping them, and they would have their rehabilitation at either Dorchester or Taunton, and then may go on to the community stroke units, which there are 2 in Somerset and there's 1 in Dorset. And also there is an early supportive discharge service which takes people home early and continues rehabilitation at home. So you're right, yes, we would be looking at transferring some people back nearer to their families so that they can be visited. Now that isn't done by the ambulance service, that is done by other companies. We already do that with cardiac patients in Somerset. We transfer between Yeovil and Taunton and Yeovil, and that's done by a company that has a higher level of care than a discharge transport, but not the emergency service like SWAST.
Thank you, Councillor Legg, and apologies for not introducing you online this morning. Can I go to Councillor Rennie, please, and then I'll go to Councillor Ireland.
I wanted to just come in now because you're talking about time, and you say that this has come up quite a lot, and it is really hard for people to visualise time. And so I think it would be helpful if you were able to explain the time saved because it has been explained to us fully about once you get to the hyperacute unit, everything's ready for you and there's no triaging, it's all done and you're going to go straight in to see the consultant as opposed to the system at the moment. So I wonder if you could actually tell us the difference in time in minutes that it might be saved. As Councillor Legg mentioned, it can take 30, 40 minutes to get to Taunton. So if you could compare the time from the front door to actually seeing the consultant. Thank you.
Currently, in Taunton, you would see a stroke specialist consultant as soon as the patient arrives, only in hours at the moment. So as soon as the patient arrives at the front door, they've already done a call into the emergency department. The ambulance crew have already done that, so they're waiting for them. They know them. They've looked them up. They've ordered the scan, and they'll go straight to the CT scanner. The issue is out of hours. Although the same process happens in Taunton and in Yeovil, they are not seen by a specialist stroke consultant. So they will be seen by a medical registrar, and then they go to the scanner, and that scan is read by out of hours consultants who are on call. Now, there could be a delay between the registrar seeing that patient and deciding it might be a stroke, who then goes to the scanner, who then has to wait for the consultant who's on call to read the scan and to come back with the diagnosis to say, yes, it's a stroke or not. What we really want to do is have a specialist stroke team on full 24/7, so that actually out of hours, everyone's seeing a stroke consultant or stroke specialist, so that it's quicker out of hours as it is in hours. Does that answer your question?
Yeah, I can understand why you can't do it in specific time, but yeah, because we had it explained to us previously about the out of hours consultant, and they would look at the scan from remotely.
Yeah.
Thank you.
Councillor Ryland, please.
Thank you very much. Sorry about that. But Councillor John Andrews from Sherborne East. So naturally, as Councillor Legg, we're one of the areas that's going to be affected drastically by this new way of doing things. But I think what we need to get over to the public is how, when they ring 999, say, I think we've had a stroke, where are they going to go to? What they're going to do if they live in Sherborne? Or they live in one of the surrounding villages. Are they going to go straight to Yeovil Hospital and get whatever drugs a clinician thinks is necessary, then to ship them on to Taunton, or are they just going to go straight to Taunton based on the judgment of the paramedic that picks them up from their home? That's what concerns people, because all the time we're all being told time is the essence when somebody has a stroke. So the quicker that they get whatever drugs a clinician puts into them, the quicker, the better, before they go and have a scan or whatever. But they need immediate treatment. I had a friend that got off a plane and had a stroke when it was descending. Luckily, the pilot had rung the emergency services in Turkey, and he was treated on the plane with intravenous drugs. Consequently, he's back to normal now. If that hadn't happened, I just wonder what the consequences would have been. So people are naturally worried that if they don't get immediate attention and then those immediate drugs which Yeovil would provide, what would be the consequence? So that's my question. The public must be aware of what would happen to them. Do they ring 999? Thank you, Chair.
Okay, so when someone rings 999 and they say they think they're either them or that someone else has had a suspected stroke, the ambulance is a category 2 that goes to the patient. Now they will make the decision as to where they take them. Right now they take them to the nearest emergency department. What we're proposing is they take them to the nearest hyperacute. So if you're in Sherborne, then they would make the decision as to take you straight to Taunton. They would not take you to Yeovil, where they would bypass Yeovil, because you need to get to the right place with the right skills to get the right drugs. The ambulance crew do not deliver any thrombolysis or any drugs while they're in the while you're in the ambulance. They, as I said, they phone through to make sure that people are expecting the patient, and then the scan and the team will meet the patient when they arrive. So yes, time is of the essence, but again, I would say to you that if my consultant was here, he would say there is evidence to say that even though you may travel a bit further, you do get treatment quicker. Does that answer your question?
Well, it does. It does to an extent, but Taunton, if they decided they want to take a Taunton, depending on traffic, that could take an hour and 20 minutes. And is that too long? If they made that decision and not to take them to Dorchester.
So you need treatment within 4 hours of the time of onset of a stroke.
Okay, thank you.
Councillor Ryland.
Yeah, thank you, Chairman. I think much has been said already. As presented, the consultation is basically Hobson's choice in it, because regardless of what we respond people are either going to be taken to DCH or they're going to be taken to Musgrave Park. That's it. And that was very clear from the Dorset consultation we had recently. So we don't have a choice in that. So the only choice we do have is, A, whether we respond to the consultation, and I think as People and Health Committee representing Dorset residents, we should. And therefore the choice is whether we want an acute unit, i.e. post-hyper, in Yeovil or in, and in my mind, I defer to people who know better than me, but it would seem better for people who live near Yeovil to be moved back to the local area, and presumably it would also take some pressure off DCH. So if you're looking for an answer to your question, I think we should respond, and I think we should respond to A. There you go.
Thank you. I think, was Councillor... Okay, Belinda Ridout, please. Sorry.
Thank you. Thank you, Chairman. Belinda Ridout from Gillingham Ward. I think it is very important that Dorset Council responds to this consultation. It's clearly going to affect certain areas of Dorset, especially rural areas in the northwest. At the moment, when there's when stroke strikes, patients are taken to Salisbury because we come under that the Salisbury Hospital, or Yeovil. Under this new scheme, if someone in Gillingham goes with a stroke, they might be taken to Salisbury, but also equally, they might be taken to Dorset County Hospital with the hyperacute unit, which is further away. As a Dorset resident, could they then, or if they go to, could they then come back, if Yeovil stays in as an acute hospital for stroke, could they then come back to Yeovil so that they are closer to family and for travelling, etc.?
I think it's really important that someone who's had a stroke is as near to their family as they can be. The first 72 hours, most people would say they want the right treatment and they don't really mind where they go. If you talk to stroke patients, they would say that. But I think after that, it is so important that you're near to your family because, having a stroke is very devastating, and having loved ones around, particularly as well to support the nursing and the therapy staff and also the medical staff, answer questions and things like that is so important. So I think I would say, yes, there would always be the option of moving nearer if that was a nearer place to where you lived, because it is so important that you are as near to your family as you can be.
Councillor Orell, please.
Thank you, Chair. So, Councillor Orrell from Melcombe Regis, Weymouth. I'm inclining towards option B, and I'll tell you the reasons for that are medical and geographical. I have worked as a doctor at Musgrave Park and as a GP in Yeovil for 7 years, so I know the geography. The geography is such that the links from Yeovil to Musgrave Park are actually reasonably good. You can take most of it quite rapidly because there's a 303 road you join in, and that's going to be upgraded with an M5 link, which is contrary to this problem we have in Dorset, where going from here to Bournemouth is a nightmare. It's quite different in Somerset. They have good links which are getting better. So from the geographical point of view, it's not such an impediment, even though there is a greater distance. So that's the geography. The second is the medical bit. We all might like to think that when we've got to a hospital, we've reached the finishing line and we're safe, but we're not. It does actually depend a lot on which medical team you're under. And the situation in hospitals is, call the specialists, because you specialise in cardiology, hearts, respiratory, lungs, whatever, and you end up under a team. The problem with specialists, they become partialists. They become very, very good at less and less. And if you end up under a team whose speciality isn't strokes, with the best will in the world, you're not going to get the optimal treatment. So I find the arguments about moving to a single unit quite compelling. There's one of the pages explains that. It's page 24. The point of having a hyperacute unit which does all the decision, you get the scan quickly. The scan's really important. People are asking, why can't you have the thrombolysis in the ambulance? The reason you can't is you have to work out what kind of stroke it is. There's two kinds. There's the clot stroke, which needs thrombolysis, needs clot busters. But half the strokes aren't clot strokes, they're burst blood vessels, hemorrhagic strokes. And if you give a clot buster to that, you're going to make it worse. So you've got to get the scan, and it's got to be interpreted properly by someone that knows how to interpret scans. So although that's why you've got to get into a unit where this is their specialty. They're not doing this as a sideline on top of their day job. This is their main job, and that's what you'd get in Musgrove Park. And the other two big selling points, you've got a neurology team, because there are other conditions which mimic strokes, and you've got vascular surgery, which is sometimes the clot busters don't work, and you go in surgery and you take the clot out, and that you get at Musgrove Park. So for all those reasons, geographical and medical, despite the greater travelling distance, I think people will get far better treatment if they go to Musgrove Park. Thank you.
That requires a response.
I think, that's absolutely right. I still think that there's a lot of people who would want their loved ones nearer, because although the travel links are good to Taunton, it's not so good if you don't drive. And I think, that's one of the things we've got to take into account when we're thinking about relatives and carers being able to visit their loved ones.
Okay, thank you. Councillor Penfold, please.
I think the most important thing is to get the message out to the public, and the fact that I'm where I live. I'm very lucky because I'm halfway between Yeovil and Dorchester, so I've got a choice, but not everyone has. And as Councillor Ralph said, it's the geography of our area which isn't always easy at times. Thank you.
Thank you.
Just Robin.
Can I... Longer. Could I have Councillor Cook, please?
Thank you, Chairman. Councillor Robin Cook, Stour and Allen Vale Ward. Yes, we should consult. I think that's a given from what we've heard around the chamber this morning. We should consult on this. You can find arguments for and against both options. If I were the patient, I would want the best for me. And if I can just give you a life example just for a moment, it wasn't a stroke, but I was taken to hospital just 2.5 years ago, blue lighted as an emergency. To be honest with you, I didn't worry where I went. I was concerned that I went to the best place that could deal with the issue that arose out of this, which was the case. And that was further away from home than perhaps it would have been through choice. I was moved around a bit after that, and okay, it didn't bother me particularly, and we couldn't get visitors anyway because we were in the middle of COVID at the time, so it wasn't really an issue. But I think, on balance, as the patient, I would want the best care as quickly as possible, and I mean, this time and distance thing, you're never going to resolve it. And I think my relatives would want me to be in the best place for the best care as the priority. Yes, I can understand about wanting to move back closer to home, yes, but if you're in hospital, you're in hospital, and there is an issue about transport, rural transport, people without their own transport. I know all those, but I think on balance, option B, if it has to go down that route, will give the best outcome for the patient or the resident. That's what we're concerned about first and foremost. What worries me slightly with this and so many other things, that we're not tailoring the product to suit the customer. We're tailoring the customer to suit the product. And I know that's a bit banal, but that's sometimes how you can look at it. And, I wonder when those times when we used to do it the other way around, and I understand all the pressures. But I think if we consult, that's the line that I think we need to take as an authority. Thank you.
Thank you. I don't think that needs an answer. Councillor Legg, please.
Forgive me for coming back, because you've already indulged me quite a bit. But based on Councillor Andrews and Councillor Penfold's question about getting a message out to the public about what will happen if you think you've had a stroke, the response which was given to Councillor Andrews' question, I thought was at variance to the response we were given by the Dorset NHS representatives at our last gathering, because the Dorset representatives said quite categorically, if you live in northwest Dorset or you live in South Somerset, the ambulance service will take you directly to Dorchester. There won't be any quibble about it. They'll turn up and they'll whisk you away to Dorchester. What the lady, and I'm afraid you're too far away on the screen for me to get your name, so forgive me, but what she said was that you would be taken to Taunton. And this is this kind of mixed messaging. If we're going to explain to the public what these changes mean, there must be clarity, and I think there's ambiguity at the moment.
Thank you. Would you like to respond to that at all, or are you happy with that as a statement?
I'm happy with that as a statement. I think, we have been working quite closely with our Dorchester colleagues. I'm not so familiar with the Dorset geography and where people live, and I think we need to do a bit more work perhaps on that as we come through the programme of work, and when we get to the point of the end of the consultation, and then we're deciding what we need to do. So I think we would need to do a bit more work on that. So thank you for raising that.
Thank you. Could I go to Sally, please?
Thank you. I suppose want to clarify what we were saying last time is, on the basis of there being no hyperacute unit in Yeovil, the paramedics, as they do with all calls, will be dynamically assessing which is the quickest place they can get the relevant patient to a hyperacute unit. And given the geography and the proposals, it would be Dorchester for the populations that have been analysed in that paper where you referenced earlier, I think, Councillor Legg, that Somerset's analysis was around 270 and we'd said about 265. So that group of people, Dorset County would be the default unless there was some overriding reason that led the paramedics to determine they could get to Taunton quicker. Julie, do you agree that I've expressed that as you understand it also?
Yes.
Thank you.
That's right, yeah.
Councillor Ireland.
Yeah, sorry, I think we're just going around a bit in circles now. Bottom line is the consultation says you're going to be taken to a hyper, which is, as John Orrell has said, where the people who know what they're doing are. And that's not going to change regardless of our response. The response we have is where they're taken essentially for rehab, which is the acute. I'm just reading George's story on the paper. And they get the example that if he, under option A, George would be transferred back from Musgrave Park to Yeovil and his relatives could visit him from Wincanton, as opposed to having to drive to Musgrave Park. That's essentially it. And so it's up to us how we decide how we respond. But, that's the choice, is where we have the rehab. So.
Okay, can I just ask one question around the financials, which are on one of the pages, on page 33 of the consultation. If we suggest that we go for option A, which keeps the hyperacute at the acute unit at Yeovil, the costs are quite more than if we just go for one unit. Will that have any effect on Dorset County Hospital? Because surely there will be more people transferred to Yeovil from Dorset, DCH, therefore there'll be less need for beds in DCH? I don't know whether Dorset DCH staff can answer that one for me.
I have put my hand up, although I'm not from Dorset County, I'm from NHS Dorset.
Sorry, can you answer that one for me, please?
Are you?
She can't answer it, I think, because she's NHS as opposed.
I'm happy to discuss it, but I thought you were looking at somebody else. I'm sorry, I can't.
Okay,
I thought you were
sorry.
looking at someone else. Whatever option ends up being implemented, we will be working with Somerset ICB to make sure that the funds flow appropriately to cover that. So should there be well, there would be the hyperacute impact on Dorset County would result in funding coming out of Somerset's contract with Yeovil and our contract with Yeovil and being put into Dorset to enable them to afford to employ the additional staff. Similarly with the acute, so that the following the hyperacute phase, whatever the decision is, we will adjust our contracts with Dorset ICB will adjust its contract with Yeovil to enable Dorset County to have the additional money to cover it. I didn't explain that very well, but what I'm saying is the funds will follow whatever the patient outcome is going to be, so that Dorset County can afford whatever additional capacity they need to provide to deliver for the Dorset patients and indeed for the Somerset patients, but your interest obviously is the Dorset patient.
Okay, thank you. I thought that's what you were going to say. I think I'd like to draw this discussion to an end. We've had quite a wide-ranging discussion. Can I just ask, Councillor O'Leary, you haven't asked any questions. Have you got any questions on this?
Thank you, Chairman. No, I don't have any questions.
Thank you. Councillor Andrews.
Yeah, thanks, Chair. Just a quick point. Could we put John Orrell in front of a camera and explain what he explained to us so eloquently, to explain to the public? Because having a professional is a limit of trust, right? And what he said made total sense to me, and it will make total sense to the public. So just a thought.
Yeah, I think, as the Vice Chair has just said, I think he needs a new job. We could, yes, use him in our comms team. Okay, so what I'd like to propose, I'm getting a feeling that the committee would like option A as a response to this consultation. So I'm therefore going to propose option A as a response. Oh, I've gone brain dead. Councillor Wharf, would you like to come in, please?
Chairman, I too have the occasional brain fade, so I really do understand, and no insult taken. Chairman, can I just say, as the portfolio holder, I've listened to the debate with interest, and it's been a very constructive debate. This is a consultation, so there's nothing. I mean, this is absolutely your territory, and I'm delighted. All I can say is I'm glad I've listened to the debate because I feel better informed. And when you submit your response to the consultation, and when you get an answer to that response to the consultation, you may care to come back to me if there's some issues that you think we can help with in terms of our relationship with the ICB, the ICS, etc. But I'm not going to take any part because this is your call. But thank you.
Thank you very much. Could we have a vote as to whether we are happy responding to this consultation from, it will be from Health Scrutiny Committee, it won't be from People and Health, it has to come from the legal part of this committee. So if I propose that we go for option A, could I have a seconder, please? And could I have a vote, please, of committee members? And okay, is anybody voting against? You're going for B. That is fine. Okay. What I'd like to do is just have a small working group of about, I don't know, 2 or 3 of us just to fill this form in and get it off. So if there's anyone who would like to volunteer to help me with that. Councillor Ridout, Councillor Ireland, Councillor Cook. I'll be on it. So, okay, if I can ask George to arrange a meeting to respond. We've got until, I think it's the 24th of April to respond on this. Okay, thank you very much for Sally and...
I can't see her name.
I can't
Julie.
see names, I'm sorry. For the people
Julie.
who've come to... the people who've come to talk on this, I very much appreciate the time that you've given for our committee, and we'll complete the consultation and let you have it in due course. Right.
Thank you for having me.
Okay. If we can move on to the next item, which is the Community Safety Annual Scrutiny Report, which we've got Andy Frost is going to do a very short presentation on it. And we've also got Ian Hunt as well. I'm having a bad name day today.
Thank you, Chair. Actually, if I can just start by giving apologies from Councillor Graham Card-Jones, who's the Chair of the Dorset Community Safety Partnership, but couldn't be here today. So as members will know, this committee acts as the Council's formal crime and disorder committee. So you have a role to scrutinise the work of the Council and its partners through the Dorset Community Safety Partnership, which is our legal community safety partnership in Dorset that tackles community safety issues. Legally, the Community Safety Partnership must report to this committee at least once a year, although there can be more frequent reports depending on whether members have particular issues they'd like to discuss. And the report today covers work and activity over the last year, focusing on three main areas, really. The Community Safety Partnership's Community Safety Plan, which is a 3-year plan which we refresh annually, progress against the Dorset domestic abuse strategy, and some information on partners' response to new statutory duties relating to serious violence under the Police Crime Sentencing and Courts Act 2022. So those are the three main areas of the report, Chair. There's a wide range of activity, and I'm very conscious there's a lot of information in the report. We cover a lot of areas, and it's not really practical to cover everything in detail through the annual report, but very happy if things come up today to come back to committee or to members outside the meeting with additional information and to explore areas further. Very briefly, just looking at those three sections, so progress against the Community Safety Plan. There are several priorities in the plan and a number of cross-cutting issues, and the Council and its partners have been working on these issues for a number of years. I think it's really important to say that there's a long history of partnership working on issues like domestic abuse, antisocial behaviour and so on. A lot of the activity that's now undertaken is considered as business as usual, and that's specified at 2.5 in the report. However, this year there's been additional activity, new activity, and those things are set out at 2.6 as well. So we continue, as well as mainstreaming our partnership activity, we continue to grow and develop new initiatives and actions to tackle those issues. I think one thing to mention is that we've attracted various new funding into Dorset to help address our priorities. So we've had Safer Streets funding from the Home Office to support CCTV and violence against women and girls issues in the Weymouth area. And more recently, we've had new burdens funding relating to new duties around domestic abuse, which I've mentioned in the report, and we are expecting further funding around violent crime as well. So it's encouraging that we're actually getting funding in to tackle these issues, as well as using our kind of mainstream resources. Just on the domestic abuse strategy, that was a requirement placed on the Council as a result of the Domestic Abuse Act 2021, and we published our first domestic abuse strategy in January 2022. And I've explained some of the ways that we've used the new burdens funding that we've received in relation to that new duty at 3.5 in the report. And then finally, just on serious violence, this is a new duty that's been placed on the Council and partners, came into effect on the 31st of January this year. And there's a legal requirement now for us to undertake a needs assessment and to have a strategy for tackling serious violence in our area. We have started work on that. We are building on our existing partnership plans and needs assessments rather than creating new areas of activity. We're trying to make it as efficient as possible. And as I mentioned, there will be new funding attached to that work, which is being channeled through police and crime commissioners. So that's probably it in relation to an introduction, Chair. Happy to take questions.
Thank you. Can I go over to the committee? Have the committee got any questions on this, please? Councillor Rennie, please.
Yeah, could I ask a question? You mentioned we've got the new duty of serious violence. Yet Dorset Police as yet don't have a violence reduction unit, and I think it was something our new PPC was lobbying for. And I hate to say this, I'm sorry, I'm a member of the Community Safety Partnership, but quite new to it. I don't know if they have been lobbying for a serious reduction unit, because when you read the paper from the serious reduction unit, it is so obvious that it's an extension of the partnership working that you spoke about earlier on. And you don't have to have serious crimes to need a serious crime reduction unit, because they are there to point out the areas where that partnership working will work to stop us having the serious crime reductions, serious crimes that we need reducing. And we do have these crimes in Dorset. And when you read it and you see how that work can bring about that change, I can see the importance of having a serious crime reduction unit. Perhaps, I'm sorry because I didn't warn you about this, perhaps you can tell us why we haven't got one, what the reasoning behind it is, and if we are any nearer to having one if we need one. Thank you.
Thank you, Charles. I'll do my best. I mean, the violent reduction units are something between the Home Office and police forces directly. My understanding is that the Home Office have gone through a process of evaluating which forces meet the criteria for that based on whatever their approach is, and that Dorset doesn't meet that threshold. Having said that, I think the positive is that the new requirement for each area, including Dorset, to have a needs assessment and a strategy to tackle serious violence allows us to do a lot of that work. So we will be looking at what our issues are specific to the Dorset area, and then what interventions we need to put in place to tackle those, and utilising the Home Office funding to do that. So although we don't meet the threshold, as I understand it, for a violence reduction unit, we will have more emphasis and focus on tackling violent crime issues in Dorset. And the definition of that is fairly broad, so that actually what might be considered a priority around violent crime in one area may be different in another area. And we can put a local interpretation on what we choose to focus on. So within the guidance, sexual offences, domestic abuse, for example, come into the definition because of the nature of that crime and the violence that's attached to some of those activities.
Thank you. But we still would have the opportunity to draw down the Home Office funding, because if you've got the unit, I know you automatically get the funding. And I know that as a council, we've been able to make good use of Home Office and government funding for various issues.
Just coming back on that briefly, Chair. Yes, so basically an allocation has been made from the Home Office to the Police and Crime Commissioner in Dorset, which is that money is then available to both BCP, Bournemouth, Christchurch and Poole area, and Dorset area to deliver their work around serious violence. So that money is ours to use.
We've got the item coming up about school explosions, and I picked up a really interesting offer that I'm going to speak about later around that, so that's useful. I don't want to leave us today without actually mentioning your work around domestic abuse, because as I chair the forum, the government's funding that this council's been able to draw down has made amazing work over the last 2-3 years. And I think it would be really important today in Parliament. I'm not suggesting we do this, but in Parliament today, they're reading out the names of 100 women who are killed, and they do this every year. And we have to remember this reduction and the work that's being done of all our partners in Dorset goes a long way to help to save people's lives. You've got to remember domestic abuse is around killing people. And the work that we as a council are now doing around homicide reviews has come on in leaps and bounds as well again. So I think I would like to thank the team.
I must admit, I think that this team do an incredible job. And thank you very much for the reports and all the work that you've done. I'm just wondering, are there any other questions? Okay, so we've largely got a report, I think, to note here and to say well done to the officers. But I'm just wondering, this group cover quite a large amount of work. I'm just wondering whether there's any training opportunities that the committee would like, because there's certainly things within there that I know nothing about, I'll be quite honest. And the planned priorities, domestic abuse and stalking, sexual offences, violent crime, antisocial behaviour, rural crime and fraud. There's some of those I've got no idea on what we do, how we do it, how well we do it. So I don't know whether anyone would like to suggest that we have either a webinar on one of those, or we do some more in-depth work and go on a visit somewhere. Certainly rural crime has got to be quite a big issue in Dorset, but I don't know what Dorset Council does in depth about it, whether that is something that would interest the committee, or fraud. I mean, I certainly, living in an urban area, come across that quite often from residents, whether we'd like to explore a little bit more about what our council does for fraud. That is basically leaving out the really big issues there. Councillor O'Leary.
Yes, thank you. I represent quite a mixed ward, for those that sort of know it. Littlemore's got issues with things like antisocial behaviour, but in Preston, it is where the demographics are slightly different. The issue over there is largely around fraud, whether it be door-to-door tradesmen or people ringing up, or internet viruses, etc. I had a residents meeting in Preston on Monday night, which was very well attended, and in fact that was actually brought up, so it would be quite handy. I mean, I spend a lot of my time when I deal with the police and sort of community safety, dealing with, you know, vandalism, graffiti, knife crime, whatever. So on the other aspect of that, I think it would be quite handy if we did do some work around fraud. Be helpful for me personally, especially as a ward member, where it is becoming an issue.
Okay, Councillor Penfold.
To explore more on to rural crime. I think we're a very large area, and I think any information that we could receive would be welcome.
Thank you. Any other suggestions? Okay.
I could send the committee. We have a really good training around, an online training that you can watch at your own leisure, around, you first have done it, it's around coercive and controlling behaviour, stalking, and it, interestingly, it also includes male victims as well. And it's got live cases, and I can actually send that to you, so you can just look at it in your leisure.
On that, I would, I totally agree with you, but I'd also like to look at the theft aspect as well. Thank you.
Sorry, was that theft?
Yes. In farm buildings and things like that. Thank you.
This comes into rural crime and theft and all the other issues that are out there. Councillor O'Leary.
Just following on from what Councillor Penfold said, I think I did see something the other day going through Parliament around theft of, rural theft, and I saw something from both Chris Loader and David Sidwick, where they're doing a big thing on that at the minute. You know, the stealing of equipment, generators, and I know David Sidwick was saying to me the other day that they returned a generator, and the gentleman they returned it to actually broke down in tears. It was such a, yeah.
Okay, so what I'm going to suggest is that we note this report, but that we ask for Councillor Rennie to send around the training module that she's got. And I'm also going to talk to Andy about what we could do to give the committee more information around rural crime and what we do and how we link in with the police. And we can look at it as a possible scrutiny in the future, but we may look at it and decide everything is fine, and we don't want to scrutinise it. So if I can leave it with me and I'll talk to Andy and we'll come up with either possibly a visit somewhere. He's nodding his head frantically in the back there. Either a visit somewhere or a webinar. I'm getting fed up with webinars personally. So if we can do something a bit more active and go out as a group to look at something, that would be quite useful, I think. And I'll get back to you within the next few months. He's nodding on that as well.
Mary knows lots of farmers.
Okay, is that okay as a recommendation? George, you're happy with that? Yep.
Yes.
Yep.
The committee should be happy.
The committee, yeah, the committee, sorry. I was just making sure that George had got that and Andy's got it. Okay, so I'll get back to you on that. And thank you very much for coming this morning and for your presentation and your answers. If we can move on now to the next paper, which is school exclusions and suspensions. This was one that we were asked to do as a request from full council, which is a really interesting way of us getting a request for a scrutiny. Usually people write to us and then we have a think about it and how we can do it. But this one actually came from full council. So I think it highlights the ways that we can get requests coming into us. It is up to us whether we take them. Scrutiny is always independent. So requests that come in, we can choose to either take them forward or we can basically say, thank you for your suggestion, but no, we're not going to pursue that. But I think the school exclusion one was quite a good one. So we're taking it forward with the paper that we've got this morning. If I can ask for a short presentation on it, I think Theresa Levy is going to do that for us. Thank you.
Good morning, colleagues, and apologies from Councillor Parry. He has another engagement which has clashed with this important committee, but is absolutely in support of the presentation today, which I will come to colleagues Amanda and Kerry for in a few moments. But just really wanted to introduce this as an incredibly important area of focus for us at the moment. And when I say us, I mean us as a full council. Our mantra this year is that attendance and inclusion is everybody's business. And that means that it really is behind on all of us to think about how do we improve. What you're going to hear is a concerning position for many of our children. Too many of our children are presently not in school full time, and too many of our children, for our ambition, are being either short-term excluded or permanently excluded from schools. What we know is that the safest way, and it is an important link to that Community Safety Partnership report that we've just heard, the safest way for our children is to be safe in school and safe in school. And you're going to hear that a lot in the presentation today to really make sure that we're focusing in on that. I think we are in a context of having had a contract with our children during and previous to the pandemic in particular. There was an understanding that children would go to school and school would be there for them. The reality of the pandemic was that school wasn't there for them. And actually getting back to a sense of much more ordinary and normality around that is going to be a really important part, alongside what is and has been previously described as something of an emotional well-being crisis for many young people. So I'll hand to colleagues who have a presentation to share with you, and then really looking forward to having some debate and questions about that. Thank you.
I'm going to start by talking about permanent exclusions and then move on to the shorter term suspensions. So this first graph here shows our Dorset permanent exclusions over the last few years compared to national figures and our statistical neighbours. To work out the rate, it's one child per 10,000. So in 2018-19, Dorset permanent exclusions reached a peak, and that 0.16 figure represents 88 children and young people that were permanently excluded from our schools. This has reduced over the years. So last academic year, 31 of our children were permanently excluded from our schools, but that we don't have that comparison data yet at the moment. That's coming in the next month or so. But we have previously, even though it's decreasing, remained above the national average. This graph here is our permanent exclusions last year by locality. The highest amount was in the east, where we had 8 permanent exclusions, followed by Chesil, where we had 7. And in the north, the lowest was where we had 3. And like I said, there was 31 overall last academic year. This graph shows us the reasons for permanent exclusions, and by far the main reason is for persistent disruptive behaviour. And the information we have from the DFE, that fits in with the national picture. So nationally, most of the permanent exclusions are for persistent disruptive behaviour. This graph here shows our permanent exclusions so far this academic year. Unfortunately, since the report was written, there have been further permanent exclusions. And so far this academic year, there have been 30 of our children and young people have been permanently excluded from our schools. The highest number is in Chesil and East, who have both permanently excluded 8 children and young people. The lowest being in Dorchester, where we've seen 1 of our children and young people permanently excluded from school. This final slide shows the rate of suspensions. So for the shorter term exclusions, so fixed period exclusions, again, we can see that we are above national, and we did fall slightly below our statistical neighbours for the academic year 2020-21. Last academic year, we can see a sharp increase in suspensions, but I think we have to be mindful that in the previous couple of academic years, schools were closed for some of the time due to the pandemic. So we would expect to see an increase. But again, we don't have any comparisons to national data or statistical neighbour data yet. So in terms of what we are doing to address this, our children's services are delivered by multi-professional teams that sit in our localities. So in those localities, we have inclusion leads, for example, educational psychologists, specialist teachers, and our social care workers. Each school has a link to an inclusion lead, an EP, and a specialist teacher, and there's a joint planning meeting at least each term with those staff and with each school. And that's regardless of whether they're academy or maintained. We also have a Dorset Education Board now that has a real strong focus on inclusion. We are taking a therapeutic and relationship-based approach, which we're trying to promote with our schools, and we offer free therapeutic thinking training to all of our schools. Again, that doesn't matter if they're academies or maintained. And we also have relational practice training, and there's a relational practice forum that once schools have done their training, they can join, and it's a great joint problem-solving space for them. With the therapeutic thinking, as well as the training, there's follow-up support for schools to be able to embed that. We are now using a system called Orchestra, where we can collect live attendance and suspension data. So that means we've got a better informed grasp of where we need to focus our efforts. We've also recently announced that we're going to be giving £100,000 to our local alliance groups, which schools will bid for inclusion projects. We're looking to increase our learning centre capacity in the East area. We're introducing something called the Chesil Challenge, which Amanda will talk about. We're also looking at identifying good practice nationally that would work in Dorset and that we can share with our schools. I'll just hand over to Amanda to talk a little bit more, particularly about the Chesil Challenge.
Thank you, Kerry. So the Chesil Challenge really comes from a really deep conversation with our school leaders in the Chesil area, with all our school leaders, but particularly in the Chesil area where they are concerned about a number of factors for their children, including South Dorset's place on the Social Mobility Index, and other factors that they want to rally around the needs of our children, and they see this as an issue they want to grasp with us. Through the Dorset Education Board, our independent chair and I have been visiting lots of schools, but particularly schools in Chesil, and really want to harness the enthusiasm of our school leaders there to come up with a project together that seeks to reduce permanent exclusions, enhance inclusion in schools, enhance our curriculum, and give our pupils a great offer in that place. So it's great that we've got that enthusiasm of our school leaders, and we really hope that project will see great results here. Anything else you wanted to add?
Okay, thank you very much for the presentation, and thank you for the paper. Can I go to committee, please? Have you got any questions? Right. Oh, gosh, everybody.
Nick, Louis and Robin.
Okay, Councillor Ireland got his hand up first.
Yeah, thank you. I was very quick, wasn't I? Yeah, thank you for the report. It was really interesting, and thank Councillor Claire Sutton for actually helping us get this to this committee. I keep going back to Professor Marfleet's paper, which he co-authored last year, Forgotten Towns, which, as already mentioned by our officers here, mentions Weymouth and Portland's basically propping up the social mobility index, bottom and lower average wages, all those sort of things. And looking at the report, it mentions that basically if you're on free school meals, so by definition probably from a poorer family, probably less well off, they're overrepresented in the statistics. And the Chesel locality is basically, if I've read the report right, pretty much top every time for exclusions and suspensions, hence the Chesel challenge, I'm assuming. And I know the nature of averages nationally and things, you've got to be on one side or the other. Unfortunately, we always seem to be on the wrong side. We're higher rather than lower. And I see there's a list of things to try and change, but presumably all the authorities are probably doing the same sort of thing, I guess, good practice and all that. So my view is that I think most of our problems, certainly in the Chesel locality, is they're underlying causes, which I'm not completely sure this council on its own can actually resolve. So do you really think it's going to make a difference, given that, bottom line is Weymouth and Portland has been suffering for several decades now? And, okay, we need to provide better education, but the underlying causes are still going to be there unless we improve people's wages and position.
No, it's a really helpful intervention. Thank you, Councillor Ireland. And I'd say two things, really. Clearly, we are very alive and alert to the families' real lived experiences at the present time, and in terms of some of those issues about how tough it is for families, we're seeing every day in the pressures that we're experiencing alongside them. But I'd also say there is a reason to be hopeful. We have already, so we are saying, and I opened with saying it is not good enough where we are at the present time and we want to be better, but we are much better than we were. So we know that we can have the impact with our locality model. We know that we are able to overturn some permanent exclusions. I mean, I would say some of the reasons why some of our children are permanently excluded are very serious. And, they are very serious, and we, as a senior team, look at all of them. So we are able to, at times, turn those over and have a different conversation about different options. So that kind of hard, long lines work will continue, and it needs to. And you can see that the issues in the East are pretty high as well, and they have a different element, and we're looking at that with a number of those schools as well. Our Dorset Education Board, which Amanda may go on to talk more about the Chesel Challenge in particular, but the Dorset Education Board, there is a very loud sense of consensus and agreement from our school leaders, many of whom are academies from the Chesel area, saying that we all want to do this together. Only 37% of our schools now are maintained schools within the local authorities. So we have long ago sort of passed the tipping point of that. So it's even more important than ever that we have really good experiences and relationships with those execs of the multi-academy trusts, and we do. And we absolutely have an agreement with them that they will work with us around the children that are in their schools and the children that are in those communities. There is more to do to really turn around the lives of some of our children, and there are some number of projects and approaches that we're looking at in the Chesel area in the coming months, which we'll be able to talk about more in this committee and others very soon, to really focus on the very little ones. What we're seeing equally around being school ready is that we are seeing that COVID delay, and we're seeing that kind of bubbling through and some real challenges with that. So we want to do better with that. But you can see from the fixed term exclusions, it is our older young people. and we need to be thinking ever more about how do we deal with that. I'm interested in all 30 children in that classroom. There's a bit of a debate that's happening nationally and maybe locally about the 29 versus the 1. I don't think we need to distinguish. The 1 can be exceptionally disruptive and disrupt the 29. We get that. But I think we need to keep the focus on all of our children in all of those classes and really work to make sure that's a good outcome for them all.
Really, really good answer, and I do appreciate that. Is that okay, Councillor Ireland? Yeah, thank you very much. Okay, thank you. I'm going to go to Councillor Orell next. Yeah, the only reason I'd like to have a quick discussion with Councillor Orell, because I think you've got the questions from Councillor Sutton, who was the councillor who requested this scrutiny. Okay, he's just going to check his emails. Councillor O'Leary, please.
Yeah, the first one is a question for myself, and the second will be coming on from what Councillor Ireland said. In my ward, I have a number of young people that are either in part-time education or excluded, either long-term or short-term. The problem I have, I think Benjamin Franklin said, idle hands make the devil's work, is when they are just excluded from school with nothing to do, then they are around, the estate where I live, which is, a very deprived area, getting into all sorts. I mean, not all of them, and it's wrong to say, and I'm not saying that, but there is an issue with they're bored, they've got nothing to do. You find kicking them out the classroom, but they're then on the streets with little else to do. We do have a youth club in my ward, but obviously it's not there to operate in the daytime. So my concern is that there's nothing for them to do when they are excluded as well. And I know that you've addressed some of those points, but it is a major factor in the ASB numbers in my patch. If I can go to that and then come back with my second point, please. Thank you.
Thank you. Really useful point to raise. We work incredibly hard to ensure those children who, when they're permanently excluded, there's a wraparound support for those children. We also have a really great targeted youth offer for our children, which isn't about youth clubs, but it's about where those young people are. So meets the young people where they are. And we find that's really incredibly effective for channeling the energy of our young people, but also the other work that goes on around at point of permanent exclusion. We don't want part-time timetables, we want full-time education, and a lot of work goes into that, just to reassure.
Thank you for that. The second point coming from Councillor Ireland's point, and I'm going to have some agreement with him, which is that the situation of many of our young people are now out of the hands of this council. Our education policy, and I can say this from someone who in this room is probably the closest to leaving school, apart from maybe George, that when I went to school, I was constantly told that the goal was to get to university, get to this, get to that, and academic was the main achievement to get. I was never academically minded, I was practically minded, and my concern is that it's a national policy of the last 30 or 40 years, has been actually less than that, has been to get to university, that's your main game, academia is the full ball game. What we really need to do is look at the young people, and I know them very well, who are more focused towards practical skills and get them skilled up. Because the problem with university is you go to university, the people then tend to leave their hometowns, and the hometowns are then left with a very shortage of young people, which we see in this county and that around housing. There is a serious problem in this country of a lack of skills, both, like I say, including doctors, but also plumbers, electricians, and manufacturing people. And like I say, that is my major concern, is that it's, our education system is not geared towards that. Our education system seems to be completely geared towards academic achievement. I mean, we used to have a system in this country where if you were academically minded, you went to a grammar school, and if you were technically minded, you went to a technical college or a secondary modern, and also then went and got an apprenticeship. I will defend that policy because I think it's far better than the one we have now, but obviously that's a bigger discussion. But I'm very concerned that there are serious issues that we are not gearing our young people up with some of the things that they need. Thank you.
Thank you, Councillor O'Leary. Really helpful discussion. And I think we are, just coming back to the issue about young people on the edge of criminality, we are really focusing with our youth justice system also to be focusing on young people who have had more than one fixed term exclusion or are permanently excluded, and working preventatively before they get into that place. So we have pretty good outcomes across our county around first time entrance to the criminal justice system, but we want to do better. And what we know is that any that do end up in the criminal justice system have almost always been permanently excluded or had more than one fixed term exclusion. So it's absolutely the right place for us to put our resources, and we're doing that really proactively with our youth justice service. I think in terms of the flexibility around curriculum, I mean, we could, as you say, debate that for a very long time. We are absolutely, however, at the Dorset Education Board talking about a Dorset curriculum and thinking about what might, we can't change the national curriculum whether we'd want to or not, and we certainly can't describe to either maintained or academies how they do that. But we do all accept and agree that our young people need a different level of skills delivery. And we'll be working increasingly with that Dorset Education Board and our businesses in the next few months, and would welcome any members that want to be engaged in a symposium around a skills agenda. Because what we know is that at the present time, too few of our children leaving our schools have the right level of skills for the areas that we need them to be ready for us as a workforce. So, even if we don't take it from a kind of attainment of schools position, if we take it from being ready to be the people that we need them to be in Dorset, we're not where we need to be at the moment. So a large-scale symposium planned with the Dorset Education Board and others, and I'll absolutely send a wide invitation to that because I'd really welcome as many voices and thoughts into that space as possible.
Thank you. Is that okay? That sounds really, really useful.
You've got Belinda next as a committee member. Oh, no, you've got Robin next.
Councillor Cook, please.
Thank you, Madam Chairman. Before I go into my question, I must concur exactly with what Councillor O'Leary has said. And it's interesting because he's the closest to leaving school probably in this chamber now. I'm the furthest away from leaving school in this chamber, but actually I'm the same view because I think nationally the view towards you must go to university, if you don't go to university you're a failure, is a bad move. That's the impression you get. But however, I would support Louis on that stance. Anyway, back to the report. Thank you very much for the report. Very interesting. I'm fairly new to this. I went to school, that was about it. I didn't really, but I wasn't suspended either, which is fortunate. I left of my own accord. But it is the suspension I'm interested in, actually. And, I mean, you can drill down into these figures and interrogate these figures as much as you like. And also, I'm Stour and Allen Vale, which is east of the county, and I'm disappointed to be heading the league table. Although the figures aren't high, it's disappointing to see that, Chairman, east is top of the tree, so to speak. But the figures on suspensions, and I notice in 3.7 you are asking for more detail so you can focus on it in more detail. Are the figures including repeat suspensions or are they all new suspensions when we had that bar chart? Thank you.
That's all suspensions, so it incorporates the repeat ones as well.
No, it's a long way around to answering that question, but that's the answer I'm pleased with. But I'm pleased to see that the way we're tackling it as an authority is a very positive approach. And as I said earlier on, the figures are not high, and I don't think they'll ever be zero. I notice there's zero on primary, but they're not zero, and I don't think they'll ever be, however hard the team here work, whatever we do. But it's interesting to see they are declining. You mentioned COVID. Sorry, Chairman, if I just come in. You mentioned COVID. Obviously, that's skewed the figures as well. So it'll be perhaps more interesting to see how it is in another couple of years' time, how we're faring. But, thank you again for the work that you're doing.
If I can come here, because you just mentioned suspensions, I'm actually really concerned about the levels of suspensions that we've got, because they seem extremely high to me, and then the exclusions are quite low. So I do apologise for jumping in on this one. I'd just like to get more of an understanding of why they are so high and how we can actually prevent some of these suspensions, because I did note that some of the targeted work you do is after young people are suspended, which seems a little bit counterintuitive to me, if you can get to them before they get suspended. And my other concern is the link with free school meals, which I find that is a really strange parameter to link it with. Because just because somebody has free school meals doesn't mean they're, it's the proof between the link. Whether it's just a coincidence, it's that proof bit that I don't see. And whether there's any other parameters that could be used to identify these kids that are at danger of suspension. I remember certainly one kid in my son's class who you knew he was going to get excluded. You just knew it from the day you met him. And I'm sure staff at the school knew he was going to be excluded, and he went on to a life of crime. And it's how we actually intervene with these prior to suspension, working with the families, that I'd like to have a bit more understanding of, and whether there's any other parameters that we can put that would help us identify whether it's something from health, lack of take-up of vaccinations, something like that, that is just a trigger that something is going wrong within the family.
We certainly share with you the ambition to work earlier, and that was some of the Chesil Challenge discussion with our school leaders and other school leaders as well. So we agree that at point of repeat suspension, as Teresa described, that's the time to really have a conversation about the child. So we're looking into that both with the youth justice system, with our own team, so bringing our response earlier at point of repeat suspension rather than waiting for PX, permanent exclusion. But we also do want to continue the work at permanent exclusion for obvious reasons. And we do see that some of that work earlier on at point of repeat suspension is paying dividend for our children. So we're not waiting till later in the conversation.
I understand about the repeat suspensions. Is there any thoughts about doing it on a single suspension or even pre-suspension? Because you can see these kids coming through, and I'm sure teachers can identify them.
Yeah, so because we've now got live data, we can pick up as soon as a child gets a suspension. And as I said earlier, each school has got an inclusion lead link. So that inclusion lead link, once we see that come through, can contact the school and start planning. But even before any suspensions, each school has got an opportunity to have a joint planning meeting with their link professionals from the locality team, such as the EP and the specialist teacher. So, talking about perhaps that child you described in your son's school before we even get any suspensions. So there's that opportunity to do some planning before that.
Have we got enough resources for this? I'm just thinking, sort of back a long time, we used to have a lot of TAs and that sort of people within schools who could help support some of these youngsters. Have we got enough, or there's been lots of cuts over the years, and you hear from schools that they are very short of money for staffing. Just like to explore that one a little.
Thank you. What we certainly know from our high needs block pressures is that we have significant spend in this area, and we know that there are significant packages of support around our young people with education, health and care plans, and schools use that people premium money. So again, a kind of call out to as many children as we can accessing preschool meals who are available to them is a really good thing to do, because it's a win-win. The family get the free school meal and the school get the pupil premium. And we want to see that being used really effectively in this space. So the team's working incredibly hard to intervene as soon as we possibly can. I think one of the other just clarifications around why do we focus so much on free school meals is the evidence is overwhelming, really, around the disadvantage gap. And it's not language that we like. I always declare an interest at this point in having been one of those children and young people myself, and so therefore bring this ambition along with many other members of my team. But the reality is the the biggest indicator of a child having a range of struggles is if they are living in poverty. And you can look at a range of other things, and things like, it is an interesting question, I think, Chair, about take-up of immunisations and vaccinations, especially, again, post-pandemic. Really good for us to think with our public health colleagues around how we link that data together. But the best indicators we presently have of children being more likely to have a struggle and needing to have that real support to achieve, and absolutely many of us who have been in that position will continue to shout about that from the rooftops, but that is why we focus on it so particularly.
Okay, thank you, and thank you for committee indulging me.
Belinda next, and then Mary.
Councillor Ridout, please. And I'm still waiting on Councillor Orrell. Okay.
Been answered. It's about intervention and getting in there early, so thank you. I'd like to also thank you for all the hard work you do for our young people in Dorset. In the report, number 4, financial implications, I'm interested to know a bit more about permanently excluded pupils attending learning centres. Do all permanently excluded pupils attend learning centres? I didn't actually know that. And what happens in those learning centres has been touched on. Are there practical skills being taught? Depends on the age of the child, I guess. Perhaps you could let me know just a little bit more about that. Thank you.
So some of our children will access a different alternative provision because it may be perhaps if we put a child that's been permanently excluded into some of perhaps the groups that already exist in the learning centres, it wouldn't be the best for the existing children in the learning centres or for that individual. So you have to be careful and look at individual children and what's best for them because a one-size-fits-all approach just wouldn't work. And then in terms of the learning centres, this is something that we're exploring with them actually at the moment. So they offer a range of sort of English and maths and some of the more academic subjects that we've sort of talked about earlier, but there is a need to look at the more vocational options that we could offer through the learning centres, and that is something that we've started to explore already with our learning centres.
Thank you, Chairman. Thank you for that answer. It's just that I also look at the cost for a secondary place and a primary place in a learning centre. That's quite high. Who foots that bill? We do, I guess.
It's just to extend Kerry's point a little as well as the curriculum conversation. What our children, young people who are permanently excluded often need the most is a really relational approach and quite a specialist approach from the adults. So what our learning centres give us are highly skilled adults who really wrap around the needs of that individual child. So it's money well spent. I had the privilege of spending time in a learning centre this week and was really impressed by the level of care and attention each of those people's received. So I hope that reassures.
Councillor Moore, where are these learning centres based? Are they over the whole county?
So we have one in Chesil, which is the Compass, one in Dorchester, which is Dorchester Learning Centre, one in Blandford, which is the Forum Learning Centre, and Harbour Vale as well. So that's where they are across the county. We are looking at the possibility of an East provision, but we're looking at our whole kind of school offer at the moment. But we are impressed with some of the outcomes they get. Evermore, so we're meeting with our learning centres quite frequently at the moment to make sure that everything they do is fit for purpose, but also looking at the students they have in the learning centre reintegrating and being part of a mainstream school again as soon as possible, because that's right for the child.
Okay. I must say, the Compass is in my ward, and I've been in there. It's absolutely fascinating, a totally different way of educating a child that is excluded.
Mary. And then you've still got Councillor
Councillor Penfold.
Thank you very much indeed for that. That was extremely interesting. I was a teacher for many years, and I feel that every child has something that they can give, and it's wonderful the work that you're doing. Thank you very much indeed, and be interested in the rest of the detail. Thank you.
Right. Councillor Orell, please.
Thank you, Chair. Yeah, I've found the email. So this is a general question from Claire Sutton, Councillor Sutton, and then I'll do a specific one at the end. Councillor Sutton's question maybe picks up where Councillor Ireland's point that the school meals and exclusion overlap and how that might be a marker for poverty. And then looks at the differential suspension and exclusion rates across the various localities and notes that the suspension rates do seem to follow poverty. And the question there is how the disparity of circumstances, how Dorset Council can change that so there's not a disparity of opportunity. So that's the general question. My specific one within that is 2.5 within the report does, again, note the unequal distribution of, and then in 3.8 we have the local alliance groups allocated an equal amount of money. So would there not be a case of allocating the money differentially to where it's needed? Thank you.
Thanks. We absolutely, as Teresa said, recognise the link between poverty and poorer outcomes for our children and young people, which includes suspensions, inclusions, attainment, and a whole range of many things that affect their good outcomes as we move forward. And we're particularly focused on social mobility in Weymouth and Portland and the issues that are there. And we've just introduced a new post, which we're out to advert, actually interviewing this week for a social mobility commissioner to join Children's Services to help us work through what that looks like and work really closely with the communities of Weymouth and Portland in particular around what will work there and what's the right thing to do. So we recognise that gap and the need to have somebody really paying attention to that and focused on that. So interviews are tomorrow. So we should have a good outcome and know who that is in a few weeks' time. I think the broader question around the local alliance groups and having the tools and the things that they need to do, it's really important that those local alliance groups are able to focus on what's important in their localities around inclusion. And whilst there's different levels of need across the board. We've already invested quite heavily in Portland. We know there are other things at play in some of those other localities, and we think it's right to give them the same and equal chance to test out different interventions around the sense of belonging, around inclusion. So while we're seeing some of the free school meals issues really high at the fore, for some of our rural communities, there are different issues that cost a little bit differently to provide those services and need a slightly different intervention. So we're going to test it out with those alliance groups, see how that money goes, what that works like, and see what the lessons learned as we move forward. So it's very much a testing phase, and we think it's right that each of those local alliance groups has the right opportunity to test that out, because different things will work in different areas.
Yeah, thank you for that answer. It's very encouraging to hear that you've got a new post being advertised. I hope you make an appointment, so well done.
That's just what I was going to echo. I think it would be really useful for us to know at some time as to what their remit is and what they're going to be doing, because certainly in Weymouth, social mobility is a huge problem, and it's how to actually tackle it. It's where you start on it, because it just affects so many people in so many different ways. Teresa.
Thank you. So absolutely, I know Claire will be very happy to bring a report back in the future around some of those objectives and outcomes. And I just wanted to kind of really just take an opportunity to reference that some of those achievements that make a difference in social mobility are, again, things that we can all influence. So many of you may be familiar with this, but social mobility indicators, of which absolutely has been stated we are not where we want to be, looks both at the little people, the young people, and the older people. And there is one particular thing that unites all of those good outcomes where they happen, and that's about friendship and not being lonely. And so one of the things that's the kind of softer element of how we really change things up is to make sure that our young people, our little people, have friends, and our young people have friends. Biggest indicator for a good life outcome is when young people leave school, that they have 2 really close friends. So it's a really straightforward thing for us to all be thinking about in everything we do. How are we encouraging that friendship and that friendliness? The warm welcome of Dorset is a big objective for us. So some things in social mobility are hard, they're gritty, they're difficult, they take a huge amount of work, and some things are the softer, lovely things to do, which I know that members in this chamber would want to be part of.
that is really interesting. In my ward, we've been running warm welcomes, and the one thing that has come out of them isn't the fact that people are hard up and need to go to them. They go into them because of the lack of, because of there's people there, there's people to talk to, and people are going from one to the other.
And nobody touches people.
No.
Nowadays.
But it's looking forward, certainly. I'm doing a piece of work at the moment looking how Weymouth Town Council can start supporting these going forward. Can I go to Councillor Ireland, please?
Yeah, hopefully a very quick question. It's slightly tangential to the report, but you mentioned about maintained versus academy schools, and 37 off the top of my head, wherever. I think I'm right in saying that very soon all schools will have to be academies. So the question is, do you have to operate under some different framework, working with different schools, and do you anticipate any challenges from all going to academies?
So there's multiple answers to that, really. It was when Secretary of State Zahawi made the policy directive around 2030, everything will be academised. I understand the date has been moved to the side. So there's not particularly a ton of chasing down that date, but my expectation is that the policy will continue. I've always maintained that I remain agnostic about the status of schools. And I work. No. I'm not giving a political answer, if I'm honest. When I meet with heads, I sometimes go out of my way to make sure I don't think about what their status is, and we talk a lot across our whole team about what we share, whatever the school identity is our children. And so I am genuinely agnostic about the status, very respectful of it, but absolutely our objective is to make sure those outcomes are good. There are some particular issues for us as a local authority to think about with 100% academisation, and there's some financial elements which we need to think about in terms of what impact that can have on our budgets, and that's on the agenda. And we also need to think about how and where we want to position ourselves around any trading we do with what are fundamentally companies who will be running our schools, and how we operate those things. We have some continued responsibilities, which are really important ones. So if Ofsted have a concern around a school, they are also agnostic about their status in terms of my responsibility, along with the team, to look into those concerns, investigate on their behalf, and we do that regularly. And we also offer a range of support services, clearly, to the children who are in the vulnerable children's category and whatever the schools are. So different, yes, but not impossible in any way. And in fact, we've got a good framework for how we work with our academies at the present time. And I would want to say that what we want to celebrate is the fabulous academies and maintained who work in the language of inclusion of our children. And those colleagues will always get our biggest and loudest support. Thank you.
Right, I think we're about... Oh.
Could I speak?
Yeah, okay. Councillor Rennie.
Thank you. So much of what everybody said, it all comes together to help and support these children, these young people. And I think one of the areas we've not touched on is crime. And I think these children are at a huge risk of crime. And you only have to talk to the youth offending team to understand that as well, and go to Community Safety Partnership, you hear it. And adverse childhood experiences, ACEs around children. And as I mentioned earlier, I was reading within the documents that we had for the community safety about the violence reduction units. And one of them in there, I think, hit the nail on the head, because when we had the conversation, Kerry, we talked about young people in year 10. And this follows a theme through the documentation within that report as well. And one of them, they talk about the impact of living in chaotic families, families with domestic abuse. And I know that you work around this, wrap around the family, and so you're aware of all this that's happening. And it said there's a project called Choices Project, and it's delivered by an organisation called Equation. And you mentioned therapeutic courses and learning. And I think that this seems to be a really good way when you're talking about these experiences, the lived experiences Teresa's always talking about, and I think it is so important. And it talked about, again, the projects always talk about this year 10, where it seems to sort of reach a peak with young people, and participants were predominantly excluded from mainstream school, but not just them, probably children who were coming towards that and the other families, because you have the mix of experiences as well, don't you? And it talked about how children had experienced or had been exposed to domestic abuse, and they were now demonstrating aggressive or violent behaviour, as well as negative attitudes towards women and girls. It said, and I think that this is a bit like Louis was talking about, the project had a clear learning aim, and it was participant-led, but it enabled young men, in this case, to explore their feelings in a safer environment, while providing them with tools to problem solve and manage feelings of anger and building their self-esteem and aspirations. And then it moves on to talking about child exploitation, and when you look at it online, and the county lines issue, and the cybercrime between young people together, and bullying, just total toxic behaviour that's happening amongst some of our young people. Not all of them, it's a small percentage. But it's easy, for me, in the field of DA, you can see why it happens, because you're looking for... domestic abuse is about control. And if you can have control of one part of your life, and school, if you can't be in control of your own elements of it, it must be really difficult for them. And so I was really pleased to hear about the therapeutic programs and the work that happens, like at the Compass. I think it is so important. But there is maybe an opportunity for some funding here in Andy talk about. Police and Crime Commissioners have got some funding. And if we can pull this together to the exploitation of young people, and from the youth offending team, because I think this council, just in the time that this council's been formed, it's amazing the partnership work that's coming together around a whole family, and that work being done, and about keeping that family together. And they have friends when they're kept together as well, don't they? And I like Belinda and Mary said, I just applaud this work. I think it's so important. But this is our future. And I think everybody in this room is feeling that they're engaged with this, and they want to be involved with it and help you however we can help you to make this better. I think it was a bit of a rant, really.
Claire's.
I think it is on. I can't see a light. Really helpful, Councillor Rennie, and absolutely pulling together some of our resources and our funding is a really important thing for us to do. And we've already started some of those conversations together around some things that are coming through that we talk about. But I think I just wanted to pick up your point around interventions for those that are on the edge of getting involved in violence, actually, and what that looks like. We've been working with the Tavistock Centre to put in a bid for the Youth Endowment Fund, which is all about the prevention of violence and working more closely with families. And we've been successful in that. So there's a programme of intervention coming to Dorset, led by Tavistock, that we will have access to, which is around family therapy and coming together and addressing some of those issues where there's parental conflict or where there's domestic abuse, but we're worried the children might get involved in violence. So I'd be really happy to bring something back in the future about what that looks like as it develops, but it's really exciting, hot off the press, new funding coming to Dorset from the Youth Endowment Fund, and it's about testing different interventions to see how well they work, and will contribute to the national evidence base as well as our local evidence base for Dorset too.
I think this situation of having children, not just children who've been excluded, but other children, because you already feel bad enough. So if you're only with the people who are feeling bad enough, you haven't got those positive role models as well that are there. And the other feeling, because you still, when something's going wrong for you, you feel very much, oh, well, why is it me and why am I alone in this? Thank you.
Thank you. I think we've had an extremely good debate on this. It's been really, really interesting, probably half, 3/4 of an hour that we spent on it. So just pulling it all together, I'm just wondering where we would like to go from here. I'll certainly give feedback to the portfolio holder who's not here today. But could I just ask Teresa, where I started this debate was I was thinking that we need to do more work around suspensions. But I'm not sure now. What I want to know, if you can give some thought as to how this committee can add value to what you're doing. Because it feels to me at the moment that there's an awful lot of work being done and there's no point in us getting involved when we don't need to. But if there's some way that you think our committee can add value to the work that is being done at the moment, that would be really useful for me.
Thank you, Chair. I'll certainly take that away and think through around how that might also feed into the Education Board, because we're really keen that the Education Board also fits very closely into our political process. And there's something about keeping a watching eye on these figures. We really welcome that. We do keep a very close watching eye on them. So very happy to kind of go through that. And then, as I've said, that skills agenda, which of course is our ultimate outcomes. You know, how many of our children and young people are getting into the right kind of opportunities for work and learning later too. So I think that's the other place we kind of see that end point. Thank you.
Okay, so perhaps at some time if we can have something around the skills agenda, because that is going to be the next big one, and that will cover Councillor O'Leary's and also Councillor Cook's concern on that. We'll have, if we can have a talk about that after the meeting and how that's going to be basically phrased and sorted, that would be absolutely brilliant. And in the meantime, I think we can, I hate the word, but note the paper. But I think we've actually given it quite a good discussion and a good debate. And I think it's been really useful. So thank you very much.
Can we note and thank?
We can.
So
we
many
can.
People said thank you.
we can note and thank officers for coming this morning and for all the work you're doing on it. I've been really impressed that we're not just sitting on our laurels, that you are doing all the work that's needed in the background. And thank you very much. So you're very welcome to stay for the next part, but if you need to go, please creep off now. We're on to the last part of the agenda, which is our performance review. Have we got David Bonner? I think he's coming in. Aha, there he is. Good morning, David. Hoping you're well.
Hello. Yes, thank you very much. Good. Just in the morning still. Good morning, committee. Good morning, chairs. Hello. So, hello.
We had a meeting of the committee yesterday afternoon just to go through some of this with David, because it's such a huge amount of information that we are given within this performance management report. If I can hand over to David, because there are a number of areas that we did look at, and we've included, sorry, Councillor Ridout was unable to make the meeting yesterday, and her comments have been included. But if I can just say the ones on HR, I think will need to be passed over to the other scrutiny committee to deal with. Okay, so if I can hand over to David to go through it with us and decide what we want to do. Our options within this are to ask for information, really, whether it's something we're concerned about, whether we just want to keep a watching brief on these items, or whether we just want to just leave them as they are and not do anything about them at the moment. So if I can hand over to David, thank you very much, that would be brilliant.
Great. Thank you very much, Chair. So we did have a discussion yesterday on the current metrics in the system, and we have identified various metrics that are currently read or have been read, so that is to say off track, or outside of target for the last few months, or indeed there were some concerns around direction of travel. So the dashboard is on screen at the moment. It's currently filtered to the red metrics. As you can see, there are various red metrics on the list, just as I scroll down there. But some particular items did come out for discussion yesterday as items of particular potential focus. So the first of those was, or the first set of metrics were more broadly around homelessness. So I'll put the first one of those up. And that is around the number of cases or new cases that we've received around homelessness approaches. So I'll pass back, Chair, for comment around homelessness.
Okay, can I ask if there are any comments? I think the ones with homelessness are all very linked together, aren't they? Because the ones in temporary accommodation and the percentages of pregnant women and families in B&B,
yep.
I think this all links together. So could you go through all of the housing ones and then we'll discuss them, please?
Certainly, Chair. Okay, so the first one is more broadly around the number of approaches, which the latest released figures for January were 405. If I just hover over that metric, you can see that that is broadly in line with where we were at this point last year. Although if you look at the lighter blue bars on that graph, over the last few months we have been slightly higher than at the same times last year, and the direction of travel is currently flagging as red or negative. So although figures do tend to peak in January after Christmas, and as the commentary outlines, there's a hope that those will fall off as we go through the early part of this year. It was discussed yesterday as an area for potential consideration. As part of that, the net number of households in bed and breakfast accommodation for the month was shown to be 90 people. That is showing some improvement. Again, if I just hover over that, you can see that we are slightly lower than we were at this point last year. So it's outside of where we would like to be, but improving. However, if we then drill down into some of that, the percentage of pregnant women and families in bed and breakfast accommodation exceeding a 6-week stay is 26.32%. The figures remain quite high and are being flagged as an area of concern. And again, if I just hover over that, you can see that they are higher than they were at this point last year. So I think those are the three sort of sequential metrics that were looked at, Chair. I'll pause at this point.
Okay, thank you. Just going to committee. Have committee got any comments on this? I'm personally very concerned about the levels of homelessness and the way this is going at the moment. I think Councillor Rennie wants to come in.
I wasn't taking a breath.
Okay. What I'm wondering is, I don't recall this committee having looked at homelessness before. I'm just sitting here trying to think of it. I don't know whether George is going to say, yes, Chair, you did it in.
We received a briefing paper from the homelessness team after the last.
We did. Right, yeah, we did. We received a briefing because we highlighted this as a concern after the last meeting, which you will all have had. I'm wondering whether we need to bring a paper forward for discussion on this, because the metrics are all really not where they need to be on housing and homelessness. So can I suggest that we put this onto our forward plan and we'll talk with officers with regards to that? Could I go to John, please?
Hi. Yeah, so in Vivian's absence, I'm more than happy to take this away, and we can consider bringing a paper back on the suite of PIs to scrutiny.
Okay, thank you very much.
And I wonder if when we do look at it, because now we're hearing about so many families that are in B&B and temporary accommodation, and we heard the earlier report about the children being absent from schools, and the whole picture of it, as when we're looking at it, can we not just can the figures be expanded a bit so we know sizes of families? Because we know, like the last time we had had a conversation about the numbers on the list. Well, it was like the households on the list, but a bit more information around the families and the size of families and the age of the children. Because it's quite worrying, this, because I know why we're doing it now, but at one time we were never even allowed to put families in B&B, were we? But the problems of finding accommodation now is really difficult.
Yes, I mean, we can definitely put a family lens around some of the data to promote that discussion and debate.
Okay. Councillor Ridout.
Just a quick one, Chairman. It may have been resolved yesterday, but adults, AD 23, the chart, there's no data on there. Number of long-term empty properties, 2 years or more, brought back into use.
If there's no data in the system, we can certainly take that one back and find out why for you and get that populated in the system. It could be that it's apologies without drilling through into the system. It may well be a quarterly metric, but I can have a look and come back with an answer for you.
I must admit, I had a look at that one myself because I think it's been at 10 for the last goodness knows how long, and that can't be right. I think it's probably a quarterly metric, but it's still an odd one. Okay, if you could have a look at that, David, and come back to us, that would be brilliant.
I'll say something around this as well. It might be worth, it may have to be a new metric, but preparing for next year when the changes come about within these second homes, because it would be interesting to watch if that releases more and more properties into the market. Because each move will bring eventually, I mean, I know if maybe a house is a large house that somebody's keeping for any reason because they can't sell it or something, or all the moves will have a knock-on effect to release some homes for families, won't it, eventually? So that would be good to keep an eye on that long term.
Okay, Councillor Ireland.
Sorry, it's not particularly on this topic, so I'm just going to say now, and you can take me later if you wish. So I apologise for missing the meeting yesterday, but I had a meeting with the new Chief Exec Joint Chief Exec of DCH and Dorset Healthcare, which I couldn't miss. But there's a question I want to ask on one particular metric, and since Claire and Teresa are here, they might be able to answer it. So, do you want to take it now or leave it later?
Can we finish with housing first? I'll take it later because I think we've got a number of metrics within children's that we wanted to look at. So if we can do them all together, that would be really good. Okay, can you carry on, please, David?
Certainly, Chair. Thank you. Okay, well, let's move on and have a look at some of the children's metrics. So the first one that drew attention of the committee was around our foster care provision and the number of active foster carers. So we have 175 active foster carers at the moment against a target of 200. Again, if I just hover over those numbers, we can see that we are just below our target and have been for most of the year. The concern from the committee was that the trajectory is a downward trend at the moment. So wanted to bring it here for some conversation around whether that is worth a deeper dive.
Okay, thank you. We have got still got children's services here. I don't know whether they want to answer that at the moment or whether they... Okay, I think we've got an answer to that one at the moment. Thank you. Phone pass over.
Hello, my name is Paul Dempsey. I'm Corporate Director for Care and Protection. We are concerned about the number of foster carers reducing. It's not a Dorset-only problem. There is a national shortage of foster carers. Since 2019, the government advises us that the number of foster carer beds across the country nationally is reduced by 5%, and at the same time, the number of children in care nationally is increased by 9%. So it is a national issue. The new government strategy for children's social care is partly trying to address care placements and increasing the number of foster carers nationally. They've announced a recruitment and retention strategy nationally. In Dorset, this isn't the only indicator about foster care, actually. Some of our other indicators are indicating some improvement. So the number of children that are living with our mainstream foster carers has increased, despite the number of foster carers reducing slightly. So we had 107 children in mainstream foster care in September, and at the end of January, that was up at 127. So our utilisation rate, i.e. the use we're making of our foster carers, caring for children, is going up. And I think that's because we're providing a better service for them. So our other performance metrics show that the fostering team visits, the frequency has gone up, and supervision for the staff in the fostering team has gone up. And we're really working hard to make sure foster carers across Dorset know that we value them and that we think they're doing a fantastic job and we're supporting them. We have recognised that our financial package for carers needs improving, and we went to Cabinet last week and Cabinet approved a 15% uplift in the income that all our foster carers receive, so that will be applied from April the 1st. And at the same time, another part of the government strategy for children's social care has been to increase the fostering allowance by 12.43%. So that both of those initiatives will make a significant impact on the financial package. It's not all about money, but we are trying to make Fostering for Dorset an attractive proposition. We are competing with other independent fostering agencies, and we are competing with other employment opportunities, and we know that there's a shortage of employees across all sectors of business. So as I say, we are working very hard to increase the number of foster carers, but we are looking after more children in Dorset in mainstream foster care than we were previously. The reduction since December has largely been about a reduction in the number of connected person foster carers, not mainstream foster carers. So connected persons foster carers are family members or friends of children in care that take on the care of them. The way that legislation is set out, they have to become approved foster carers. So they've reduced because either those children in those arrangements have become 18 or because they've come out of care via the carer going to court and getting a special guardianship order. So I think there were 6 of those situations that happened between December and January, and there was 1 mainstream carer that resigned. And we are looking at why carers are resigning, and we're not finding carers resigning because they're unhappy with the service. Some of them are going on to do something different, like being a stay-and-put carer when their child becomes 18, or being a supported lodgings carer. So we're working very hard, but there are some other metrics that suggest that we're going in the right direction to turn things around.
Okay, can I just ask a question on that? I think Councillor Rennie's also after a question. We had a paper I think it was last March, on fostering, and within it was set out the recruitment campaign that we were going to be undertaking to increase our numbers of mainstream foster carers. Can you give any information as to how successful has that been? Because I understand, I was quite thankful in a way that it wasn't our mainstream carers that were going en masse, but how are we doing with increasing our mainstream carers?
Not as well as we'd like. So clearly we've lost a few more carers than we've recruited. So that's partly the drive for us to make ourselves more attractive in terms of the financial package and improving the performance of the team. And that's something that does take time to do. We want our carers to be so happy with us that any of their friends and family who are thinking about fostering, they tell them a really positive story about fostering for us. So that's a journey we're on. We think we're doing quite well at that. We hope over the next few months and year that will have an impact.
Thank you. Are there any other questions on this? Councillor Rennie.
I've got 2 questions. I think to do with connected, if you are a family member, a connected family, if something happens and you take your children in, and something happens, and overnight you say, right, those children can come and stay with me, does that affect them becoming foster parents because they've already moved in? You know, because I know if you're a connected member, to be a foster family, you go through the fostering, a slightly different fostering process, but you go through it. But if they take a family in, take the children in, well, I hate to think of it, if there was an accident and the parents died and you took the children in, does that affect your situation over fostering them eventually, or do you get the help from them for them straight away? It was only because when you were talking about it, it just dropped into my mind.
Okay, so the legislation is set up such that if you're a family member or a friend and you take on, you know, grandchild, and the local authority has been involved, and the situation is such that the local authority would not be satisfied that it's safe for that child to be with their parent, then you as the family member taking it on, you would need to be assessed and approved as a foster carer, and the child would be a child in care. If it was a different situation, where it wasn't a situation where the local authority were concerned about the parent's ability to care safely, then that we would see that would be a voluntary arrangement and your status would be different. I think that was a question, but...
Yeah, I think where I'm going with this, if the connected person is doing it voluntarily, there's no income. I'm just thinking of the finance situation as it is now. If you were to take on 2 or 3 children, you would probably be wanting to adopt them, partially for the security, but also, secondly, for the help and the support that they would have from the local authority. And I wondered if there's a difference if you were to just say, yes, of course they can come to me. Once they're in that house, do they then have that right to go through the fostering process? Yeah, to become recognised foster parents.
Molly, Councillor Rennie, there's a masterclass in this. This is one of the most complex areas that we work in. So just so you, and Paul covered it really well, but it is really complicated. Lots of family members have every right and opportunity to look after their children without the local authority being involved in their family. And that's an important premise for us. So lots of family arrangements all over the country have nothing to do with the local authority, and they don't need to have because there aren't safeguarding issues around those children. So the disaster, the traumatic event that you described around something like a car accident, you might well see family members simply gather around, look after the children, and they wouldn't come anywhere near us necessarily. Where there are safeguarding matters for those children, we then need to make a judgment about, is it safe for that family arrangement to be outside of the local authority's arrangements? And so where we think it isn't, we need to approve them as initially temporary foster carers. It's not good language really, but they then go through the assessment whilst the children are there, because often these arrangements are emergency arrangements, aren't they? Many of those families go on to take legal arrangements to have a safe special guardianship order or another arrangement which makes them the permanent carer, and we may still support them through a special guardianship order payment. And so that's why the kind of finances don't necessarily change when the child becomes permanently living with that family. But others may well not, and so that also becomes a different outcome. We would really welcome actually at some point in the future, because Paul will be leading on developing even further the kinship care offer as part of our social care review. And I think it would be really helpful for us to think together. We've got some work already underway about how we support our families, because fundamentally kinship care, as we understand, is largely at the moment a sort of a sort of duplication of what we do with our mainstream carer situation. We're not sure that that's actually how families really operate when they take care of their kin. So we're wanting to think with the DFE about what kind of arrangements might we have in place to support families operating in the ways that families already operate around, nannies and granddads and aunties and uncles and all sorts of people taking care of their children and not coming into local authority care. So a report in the future I think is probably a very good idea, but it's a complex area.
My other question is, how long does it take from me ringing you up and saying I'd like to consider adoption to you actually being able to adopt? Foster, not adopt. I don't know why I'm talking about adoption, because I'm not going to.
It should take 6 months. So the guidance and legislation that it takes 6 months from the time that you inquire, and we are generally hitting that for mainstream carers. For connected carers, who are usually temporarily approved with the child in placement, we should be doing that in 16 weeks. We can, the law says, get an extension of 8 weeks to take that to 24 weeks where we need to do that, so which is generally half a year, so not dissimilar.
Okay, any more questions on fostering? Okay, if I can go back to David, please.
Right. Thank you very much, Chair. Okay, so the other another area in the children's arena was around the percentage of looked after children that we currently place outside of the council. So at the moment, the data is showing just over 43% are placed outside the council against a target of 30%, with a negative trajectory, so getting worse. I'll just hover over the numbers again so you can have a look. So the committee were concerned that it's been consistently above the target, and that the trend is in the wrong direction. So I'll pass back to the chair at this point.
Thank you. Would any members like to comment on this one at the moment? I think there was a lot of concerns about the high numbers of young people being placed outside of county, particularly when it was put against some of the initiatives that we've got on the go at the moment, trying to bring them back into county. I don't know whether any officer can comment on that at the moment. Okay, if I can hand over to you, please.
Thank you. I can reassure you that the trend has gone the other way this past month, so it's got slightly better, not significantly, but direction has changed, so that's come down a bit. Some of the detail around that, there are a significant number of unaccompanied minors that are included in those children and young people that are placed out of authority, and the number of unaccompanied minors has increased as a percentage of our children in care population. We're finding it very difficult to place those young people in Dorset, much more difficult than our local population. So that has had an impact on it. And the numbers have gone up from, we had 9 unaccompanied minors in April 2021, and I think now we got just under 40. So, and you can see from the narrative that 31 of those are placed out of authority. There are a number of other children and young people that are placed in long-term fostering arrangements outside of Dorset, and we wouldn't want to, even to improve our performance data, we wouldn't want to disturb them because they're in permanent arrangements and they're doing very well. So it does take some time to shift this indicator as well. We're hoping that, obviously, with new children that come into care, we place them more locally. The impact of placing more of our children in our own foster care, which in the answer to the previous question I was saying we've been doing, will be that more of our children will be placed locally, because obviously our carers, our mainstream carers are in Dorset. So we are striving to increase the number of foster beds in county, as I just said, but also residential provision. So we do have some of our own new children's home that will be opening shortly as part of our residential sufficiency package. So we do anticipate that these numbers will come down. And I think it is 65% of those children placed out of authority are placed in a neighbouring authority to Dorset. So they're not necessarily, the other end of the country. They are in that border just surrounding our county. So those are some of the details.
Councillor Cook.
Thank you, Madam Chair. Which is a bit worrying, isn't it? Because it's nearly half the number of children, actually. 43.65 is not far off 50%. It is concerning. I mean, do we have any, what's the financial implication here? First, it's the first part of the question. compared to homegrown, if you like. That's the first bit. If I can come back then, Chair.
Where we place children in independent residential provision, and a lot of them, a high percentage of those are out of county, the financial impact is not a good one because it's expensive provision. So that is something we're mindful of. That is partly driving our sufficiency plan to create more of our own in-house, in Dorset residential beds. Fostering provision is significantly cheaper, more cost-effective than residential provision. So the average fee, unit cost of an independent residential placement is around £5,000. The average unit cost of an in-house fostering placement is under £500. So you can see the financial impact. I can say that we are increasing the percentage of our children placed in foster care. So it's 73% now. It was 70% some 4 months ago. So that is going up. And I can tell you that the percentage of children in commissioned placements, i.e. those bought from the independent sector, has reduced from 61% to 55%. So we are making progress with the percentage placed with our provision. We are making some progress with the budget situation, and more of our children are placed in family-based foster placements. But we've lots of work to do, we recognise that.
Yeah, well, I think actually that the rest of that has answered the second part of my question, was how we're going to deal with it. And obviously this is very distinctly connected with the foster care issues that have been raised. And we understand those difficulties. And this has been, I mean, I was in the former authority, Dorset County Council, and we lived with that issue all those years ago, and it's still ongoing. And of course, the question with the young people, the children, is that you don't know what the number is going to be, do you, from 1 week to the next, or 1 day to the next. So it's a difficult one, but it has stuck on red for some time, and this is the concerning thing, and the figure is very high, a very high proportion. I mean, that's stating the obvious, I know, but it's sad that we can't do something rather more quickly in the way of recruiting carers, and we've covered that, I know. It's just, it is disappointing. And that's not denigrating the hard work that's done, please, on behalf of the team. It's the way that society is working at the moment, which is a problem.
Can I just ask? Please come in, Teresa.
Thank you, Chair, and thank you for your question. It's really helpful, and it's not, you know, it's a challenge we face that is part of our legacy. So I think if we could show you the kind of graph of our looked after children at the present time, it's got a really interesting shape. Okay, so we have very few little people in our care because they come into our care and they quickly now go into adoption or permanency arrangement. But our kind of shape of graph goes up like that into 16, 17-year-olds. And we have very much more, I can't remember how many now, I think it's about 160, 16 and 17-year-olds, but most of our young people are over 14, and most of them have been in our care pre-Dorset Council days. And so what we've got are young people who weren't well planned for in the early stages. One of the things that I think saddens us most, really, is when we see children who have been in our care for maybe 9, 10 years. And their permanency planning didn't happen well at the beginning. Now, what we're not in the business of doing, as you'd appreciate, is where they are in a settled placement, we're certainly not in the business of bringing them home for any kind of financial benefit. We're just not. So they are going to grow up and out with us. And we know who those children are. So we have got a really good predictive model around where our children are going to be and how that tanker turner is going to go slowly. And we can show you that predictive model in terms of what we're looking at. We do now know, thankfully, the children that are coming into our care. So that kind of belief, and it was a belief, I think, that previously you didn't know who they were coming and where they were coming from. It's not true. We do know. We'll get the occasional one that have moved into the area or something will have happened that we're not expecting. But generally, we know our children. Generally, they've been through an assessment, they've been on a child protection plan, and they've been in pre-proceedings, which is that important piece where families have had that letter from a lawyer saying, your children are going to be taken into our care unless you act and change in these ways. And we then work with them within a kind of framework. So most of our children come in that planned way. We know roughly how many to expect every month because we know our communities and we know our population. And so we are planning in a much more, concerted way. But things will look, I've frequently said this, in 2 to 3 years' time, whoever's sitting in this chair, things will look very different, actually, because those children will have grown up and out with us, and we're not backfilling them in the same way. So we are much lower in terms of the whole population than we were. We peaked at 490. If we take our unaccompanied minors out, because obviously those are the other children we don't know are coming, if we take our unaccompanied minors out, we're at about 410 today. So we've changed dramatically the numbers of our children in care. But actually the big issue about our children being out of our county is both that these are our legacy children, they didn't have good planning to begin with, and they are much more complicated as a result. And we find it really hard, don't we, Claire, to get kind of partners to come into our expensive county for property, and a real challenge around workforce too. So we don't find it easy to get the market development either. But again, very happy to have more debate on that.
Councillor Rennie.
Yeah, thank you. And like the children who have been out of county and they are becoming younger, they're teenagers now and they'll be young adults, they will be supported because they're with a caring foster family now. So they'll be supported when they reach the age 18 and they go into young adulthood. But I had a moment's horrified feeling when you talked about the number of children we've got in care who are 14, 15, and in 4 years' time, they are going to be, in theory, coming out of our system without that support. And these are the areas that we talk about, our concerns when children and young people newly come out of the care system. And it's very expensive to live here. And we have more children now being looked after. I don't want to ask the question because I know you will be planning, because in 4 years' time and under a new authority, there'll be more work there, but we'll be moving into a different arena with the 18 to 25-year-olds, won't we? And we've heard about housing and the situation and jobs. And I know it's an authority, it's a new council, and some of us won't be sitting in this chamber, but I think, can this committee go on this journey with you a little bit about that? Because I can see where this is going, and without the support that you have from everybody, that's going to be a really hard job.
I'm speaking on behalf of the whole team because we are absolutely really focused on planning together and planning with our colleagues in adults and housing as well. So 2 things to say. We're already looking at our care leaver service, which is a fantastic service, which will support all of those young people moving forward, and expanding and putting some additional capacity into plan for those children as they move forward. So that has been part of the budget build going forward in our thinking, because we know that bubble's coming through. We've been doing quite a lot of work together around what does a supported accommodation offer need to look like, alongside our housing colleagues and alongside John as well, to think through what might those children and young people need. But absolutely, accommodation, our care leaver covenant, and all the work that we're doing there is really important work. So we'd really welcome you alongside us as corporate parents as we go on that journey, absolutely. But we already started planning and thinking that through. But yeah, absolutely, that is where our focus and our attention is going to be.
Thank you.
Thank you. That was really interesting. Why does everything in this council come back to housing?
Yeah.
You know, we seem to go round in circles and then we come back to housing, that we haven't got enough housing at the right price for people to actually be able to live here.
Every subject in...
Everything
in the budget line came. And when we talked in the budget cafe, it was all housing, wasn't it?
Okay, thank you, David. Do we want to do any more work on that one? Or I think we've had a good debate on it, so we'll leave that one and do a watching brief on it. David, can I come back again, please?
Thank you, Chair. Yes, just one more area highlighted for children's, and that was around the percentage of children's needs assessments which are being completed within 45 days. In January, it was just under 80% against a target of 95%. Again, if I just hover over the numbers, we can see that it hasn't been matching the achievements of last year for the last few months, and it is below target. So committee felt that they would like to flag it today. So back to you, Chair.
Are there any questions, or can I go straight over to an officer to give me a comment on that as to why it's low and why it's continuing to be low? If I can hand over, please. Thank you.
Thank you. Yeah, we have recognised that this is an area of improvement we've needed to make. We've put some focus performance in with our teams on this, and I can tell you that performance has improved for February. It's now just short of 89%. It's 88.77%. So it's increased by 9% this month, and we will keep a focus on that. Heads of service and service managers are working to support our social workers and challenge our social workers and really increase our focus on this indicator, because it needed improving, and that has had an impact over the last month.
Yeah, thank you. This is actually the one I wanted to ask about, so it's on the list, so it's great. I was just wondering, is it purely the difference between localities, purely a performance management issue, or is it to do with staffing or volume of, wherever the needs assessments come from?
If I could just, yeah, thank you. So first of all, I'm planning to cancel Christmas because I'm afraid every year we see a big dip post-December. And every year in November, I say to people, remember, Christmas always falls in December. Could we please think about how we manage this? But it is a challenge for us. I mean, you can see year on year, it's a challenge for us. And some of that is just about kind of how we see a lot of leave take place around that time. And it's somewhat irritating. So if you can get my irritation, that everybody else does. So there are really clear allocations of resources across the localities to the identified needs. So we do find that at certain times we get certain peaks, and at the moment where we're really looking and asking ourselves questions is around the east. We do see an increase in requirement in the east, and we need to determine, is that an increase in need, genuine need, or is that other parts of the system aren't necessarily operating as well as we might like them to. So constantly looking at it, constantly driving that performance, and I think we recognise those difficulties, but it is going to be back up where it needs to be this month, and we just do take a bit of a dip in the summer and in December. And that's a challenge. We will always have some cases that are outside the time frame. That's appropriate and right and proper. And this is a kind of a loose target, really, in many ways, in terms of getting the quality of the assessment right is as important. The social care review that's coming is talking about having no timescales for adoption. Adoption, God, we're obsessed with adoption today. Molly, you and I both. What's that about? I don't know. That's it now. They have talking about having no timescales for assessment. I don't agree. I think it's really important to have a framework within which you can have knowledge about when you're going to be in a place of having a completion. So we'll be hopefully helping DFE to think that through, and we will keep a focus on that. But the most important thing to know is that whilst the assessment is ongoing, help's already in place. It's not that people are waiting for help at the end of that time. So that's the most important element, really.
Okay. Any more questions on that one? Councillor Cook.
Yeah, thank you, Madam Chair. I think Teresa partly answered the question I'm going to ask, but it's on the ones that, 6 weeks is a long time for an assessment, but I'm sure you have to rely on outside agencies to some extent and the slow responses that they give you. So it's, we must be careful not to point the finger at always Dorset Council, and maybe that some of those need chivvying up. But typically, whilst this is not a horrendous figure, 80% against 95, it's that, what's the typical time frame of those that aren't within that target? Is there a typical frame? Does it double that, 3 times that?
Rotation is taking over. No, typically it's 46 and 47 days. So part of my frustration is about this kind of performance culture is sometimes just the discipline of, really, really just get it done. I would be really concerned, and we do track very heavily, if it was 100 days. But it's not. It's just a small slippage on actually getting... And there are a number of things that can slow this performance down. absolutely getting feedback from others. Absolutely, we want families to sign off the assessment before it's signed off by us. So sometimes that takes a bit longer. And sometimes the management process of getting it signed off on the electronic system, which isn't our friend, is always a bit of a challenge. So, but you can be assured that actually people are not waiting hundreds of days. It is often, very frustratingly for us as the performance leaders who are driving this, just a couple of days. And so we're kind of really pushing people to understand the importance of just really scheduling. We talk about scheduling a lot, actually, and it's really important. It's an important skill set, and we really are driving that heavily.
Okay, thank you. I think that is it on children's, unless anybody's got any other item they'd like to bring up. Okay, so thank you very much for children's staff who are all here. If I can go back over to you, David.
Thank you, Chair. Okay, so now moving into adult social care, there were two metrics that were flagged as areas for potential discussion. I'm going to take both of them together because I think to some extent they'll be linked in terms of that conversation. So the first is around permanent admissions per 100,000 population to adults residential homes. The numbers there are higher than we would like. Again, I'll just hover over that to show the numbers. You can see the last two bars there taking us over target and slightly higher than they were at this point last year, hence the concern from the committee. And then the other metric is around the total number of hospital discharges, which remains high. So I'll pass back to Chair.
Okay, can I hand over to John, please, for a comment on that?
Thank you, Chair. Yeah, absolutely connected the two. The committee will remember through the budget process that we were highlighting that this is one area of demand from hospital which has, increased beyond any kind of planning. And it's really impacted the other indicator. It has been part of the sort of winter plan from the NHS to use residential homes to bridge gaps in provision and help, to keep capacity in hospitals. Been a really, really difficult winter. I think everyone acknowledges this has probably been the hardest winter since the pandemic, with a range of other additional things happening in the background in our hospital system. So more than happy to bring detailed paper here, but the two are absolutely connected, and they are, as we pulled out in our budget paper, one of our biggest demand areas. So working very much with our partners in the integrated care system to try and find a way out of this. But post-pandemic, if you can say post-pandemic, this is one of our biggest challenges and probably continues to be for the next few years. So some of the things that we've put in place are working. It'd be a really good opportunity to highlight some of that, as well as obviously the ongoing challenges that we face. But happy to bring a paper back.
Anybody got any comments on that? Councillor Rennie?
Could I ask a question? Thank you, because that makes it clearer to understand. But the permanent admissions to residential homes have been affected because the residential homes are taking the people from the hospitals. We are very short of care staff. So if somebody's got the need to move into residential care, and it's been agreed they've got the need to move into residential care, and there isn't the spaces, have we got the capacity in the care system? Because they'll be gradually moving up from 3 visits a day to 4 to maybe 5 visits a day. Have we got the capacity to be able to deal with that? Or will that be where we're seeing the next sleepless nights over?
Yeah, I mean, everything in adult social care is connected. So there is a sort of continuum of someone coming out of hospital. Ideally, if they are able to go home to their own residence, that is what we would want to support. There has been a gap in capacity in Dorset and nationally to allow that. Part of that is the way that we buy some of that capacity. So we've been looking at changing that arrangement. Part of it is having other types of reablement type services to, to be able to take people quickly from hospital back into the community and then support them for a handover of care to a long-term care provision. So there's gaps throughout, workforce gaps run throughout. But what has happened as a result of the pandemic is the sort of speed at which people have needed to move out of hospital, sometimes, medically fit, but still needing a period of recuperation. And that's where we've seen a lot of people go into care homes without the right sort of therapeutic support, and that comes from our community health provision. A lot of people have ended up in hospital, have ended up in care homes that with support could have gone home. So that's really where our focus is, trying to improve that, because that will drive that indicator. Once someone is in a bedded setting, they often stall in their recovery. And that's the bit that we need to up our game on. But I'm sure through the paper that we'll bring, we'll tell that story and show some of the areas that we're working in.
The opposite, not somebody who's come out of hospital. We have people who've stayed in their home as long as they can with all the support and the help that we can, but they generally are just moving to that point where they can't manage at home anymore. But this, it looks as though it's going to hold up the spaces for people who genuinely need 24/7 care in a care home, not because they've been in hospital, not because they've had surgery, but just because they no longer can manage at home and their families can no longer manage. That's the residential setting I'm talking about, because we're going to have to give more and more care to somebody in that situation. And if the beds are not there within care homes, there is nowhere for them to go. And that's the gap I'm thinking of now, rather than the from hospital and moving on. Thank you.
Thank you. Yeah, if you could bring a paper back on that, that would be really useful. If we can discuss the timing of it at some time, that would be great. If just checking that there's nobody doesn't want that from the committee. Okay, I think we've got committee support for that. Super. I think that's it from you, David. They were the ones that we highlighted yesterday.
We caught all Belinda's points.
Have we caught all of your points, Belinda? I think we possibly have. Okay. It is really difficult going through this lot on your own, isn't it? I gave it a shot yesterday afternoon, and there's just so much information there. Okay, so I think we've finished this part of the agenda, and thank you very much, David, for coming in, and all the officers who've stayed and helped us with it.
Thank you, Chair.
If we can go on to the next part of the agenda, we're nearly there now. We're on to the forward plan work that we've got. So our next agenda, which will be in May, which will be after the elections, not after the elections, after the AGM. So hopefully this committee will stay as it is. I've got my fingers crossed, and we'll all be back here again in May. We've got the long-awaited housing scrutiny coming, self-evaluation of children's services, and just one that I need to understand what it is. The progress of the implementation of the Dorset Care Framework is also coming to that committee. Does that link in with the work that we were just talking about? Yeah, okay, so if you can link those in together, that would be really useful. And then we'll decide where we're going to go from July. We've got quite a few things that are waiting to be scheduled. So we need at some time, I think, to sit down as a committee and decide almost a work programme for the year. But I think, as you'll be aware, we had a peer review in October, and the information from that is still coming through, and we're still working through how we're going to respond to that and adapt to that. So I will certainly keep you all informed on that one when I've got more information. So please let me know if there's anything you'd like considered onto the agenda, and then we've got the Cabinet Forward Plan at the... Councillor Ireland?
Yeah, it's more for information. I don't think we normally cover it in the committee itself, but Dorset Healthcare's quality account is being in draft form published soon, April, I think, so we need to address that at some point.
Thank you, Councillor Ireland. We normally set up, we've got a small working group going for those, and basically it will feed into the small working group and then through to committee. Thank you for the information, though, because they take quite a bit of looking at, don't they? Okay, Cabinet Forward Plan is as it is. I'm glad to see we're starting to get a lot more information on the subject matter put in there, rather than just titles. I think that's a lot more helpful for us. If anyone's got any comments on the Cabinet Forward Plan? Nope, I don't think so. So we've got no other business. We've got no exempt business. We've got no urgent business. So if I can call this meeting to an end, and thank everybody for attending this morning, and thank you for your input. I think it's been a good meeting. Thank you.